I do want to acknowledge that we have had and continue to have some significant headwinds. But as I reflected on kind of where have we been since we last met, my perspective on this is we've really built out the infrastructure, the support, the accountability, the governance as a board, but also in conjunction with the organization to make this a more effective and I appreciate the commissioner's push on certain things, and I think there was a stimulation to really raise the bar, particularly over our fiscal health. And the exciting part about that is I think we were ahead of the curve as we started to face some really significant challenges coming out of both the federal and state government level, and the fiscal challenges that obviously everyone is facing in pretty much every corner of the world right now. So I'm really proud of where we've come, and I'm excited to talk about not only where we are today, but where we're going in the future. And I do want to just take a minute to personal thanks to Lexi and her leadership. She has just been a tremendous partner to the board and the staff who have really stepped up to a huge challenge this year as we've had to make some really hard decisions, particularly from the budget. And the Board of Health, who, as I had to remind myself of this morning, this is a volunteer board, and we all have day jobs except for Steve, but he's given his fair share, and so it's an enormous ask of this group of people, and I want to thank my fellow board members for everything you've done to get us here. So that's how I sort of open the stage. I'm feeling very optimistic. Hopefully, we'll all feel the same way coming out of this meeting, and look forward to feedback, opportunities to improve. This is a continuous improvement path that we're on, and certainly lots of challenges ahead to face, but I think we're much stronger as an organization right now to face those challenges. So thanks, everyone. Looking forward to the dialogue.
Thank you, Lindy. Yes, we're delighted to have all of you here today. It is our one shot a year, it seems, to get the whole gang together. I'm so delighted to have you all here. It's an opportunity for us to do a little stock taking ourselves as an agency and kind of how far have we come. So we're really excited to share some of that information with you today. What we'd like to do is first go around and have the board members and county commissioners introduce themselves first, and maybe tell us what do you hope to get out of the session today. And then we'll ask staff to introduce themselves too.
I'm Ashley Stolzman. I'm one of the Boulder County Commissioners. Good to see everybody today. Some of the things I am hoping for out of the meeting today is just to convey my appreciation to the Board of Health and to Lexi and the team, just for coming so far and doing such a good job. So some of it is just, being able to convey how deeply we appreciate all of the work that you're doing, and it's showing through output in the community, but also through the work that you deliver to us and the reports that we get. So that is a big part of it for me. If we have time beyond that, I had just a couple of things down of how we approach state issues when they come up, and how we can be strategic about that together collaboratively when there's different lobbying on statewide issues that affect both community members from a county commissioner perspective, but also from a Board of Health perspective. And then I'm interested to know any issues, comments, concerns, questions about the move to 2525 28th Street, if that is appropriate and we have time. If not, we can take it offline. And then if we still happen to have time, and everybody's going to have this many topics and you have your whole packet and the read ahead stuff, but if we have more time, septic tanks is on the mind.
Always.
Let's talk septic tanks.
Lindy Hinman, Board of Health President. And, I think sort of set the stage in terms of what I think in terms of where we are today. What I'm really interested in right now is helping us understand from the county perspective what we should look forward to, right, in terms of some of the needs or challenges in our community from your perspective as it relates to public health, if there's things you have observed or willing to share with us, and any expectations as we start to roll into the next fiscal cycle, and anticipating anything that we may need to start to think about now, if that's at all possible. So those are really the two things that are top of mind for me. But I'm just really looking forward to the dialogue and the partnership.
That's you.
We shouldn't just skip over.
We'll do that.
We're gonna do another round for staff, okay. Yeah, clearly be county commissioner. What do I hope to get out of the session? I also want to start with a thanks for all the really hard work you all have been doing, not just last year, but over the last couple of years to, really get a handle on this agency, as we came out of COVID, where you had a transfer of leadership at the beginning of COVID and then sort of halfway through COVID. And, that's a lot to try to go through while dealing with a global pandemic. And I do recognize the stress that put on everybody associated with Ward County Public Health. I think what I'm really wanting, so I did my best to get through the read ahead. I didn't fully complete it. But I think what I'm wanting to get out of this is really understanding the work you've done, how you're set up for the next several years in terms of, I know you've done a lot of work on priority-based budgeting and your vision and your strategic plan and really trying to marry up your funding sources with those priorities and just really, wanting to see where you think the agency is going. And then also, do our best as three commissioners who, have to make these decisions about funding and the structural deficit that we're trying to deal with here in our second budget cycle. How do we support public health? Which competes with many, many other really important priorities in the county. How do we support you, both financially and in terms of our board appointments? Because, ideally, we appoint a board of health that responds to the needs of this agency and we kind of get out of the way and let you do your business. But but wanting to make sure I know and we know enough about what you're all doing and what your needs are so that we can be good partners in that respect.
I'm Morgan McMillan. I am a board member and I just looked it up. It's like, what year am I? I've been on the board for seemingly forever. And this is year 9, I think. So, 2 5-year terms. So I'm in my last hurrah here. And I can tell you that the agency has changed tremendously since my time began on the board, where, I think when I joined, we were much more of a, I don't want to say a rubber stamp board, but we really showed up to board meetings and the staff did everything and we sort of said, thanks so much. And we moved on. And then COVID hit and that was, that shook our community and the globe and certainly Board of Health. And then coming out of COVID, along with leadership changes, which I think really helped this board gel a lot of our own relationships and working together and figuring out how we were going to navigate those leadership changes. Then to face our fiscal challenges and also learning a lot more about our fiscal situation than I think the board ever knew before based on the information we were getting. So it's been a journey. I feel so good about where public health is now. I mean, I say that all the time to people because it was so many challenging years. I keep saying we are in such a good place from financial stability, from leadership. And I also want to acknowledge that it has been a really hard year for this organization because we lost some staff members through some of that budget work that we had to do. So, and it continues to strain our programs and the staff who still are here are working, as hard as ever, if not more, with fewer resources. So I say that we are in a really good place, and I do believe that. And I also want to acknowledge that it's been challenging. So I hope out of this meeting, it's been great to have these meetings the last couple of years. It has helped us understand what commissioners are looking for. It has certainly helped us dig deeper on some issues that we, that we did in response to some of the questions that you raised. And so it's great to continue to build this relationship and hear from you all. I do think you are looking at your own financial challenges. I'm so glad you took Armando from us so that you have
someone who's been through this before, and we're glad to have him in on your team so that we can continue to work together in partnership. And you know, and I have my own short-term concerns about the drought situation in Boulder County and how public health can best prepare for that. And it's probably not a one-year challenge. So that's another, you know, something that I think keeps us all up at night. But really just excited to hear from you all and how you're thinking about the next year also at the county, because I know you're going to have to make some tough choices and a big process of rolling up your sleeves, and those are hard. So looking forward to continuing to work in partnership with you.
Thank you. Buenas tardes. My name is Martha Luchmin. I'm one of the county commissioners as well. And happy to add on, I will try and keep it brief. I feel like I've been really clear over now 5.5 years about how important Boulder County Public Health is, what the staff is doing. I'm really appreciative of the continued read, and in the pre-read, it was good to read what y'all been working on. How are you calm? Focuses in regards to your strategic planning, and then looking at because her and Darren and I have talked over the years about how do we line up with county and how do we try and use similar messaging and keep focusing on racial equity and how equity impacts and those opportunities to do all that we can for everybody in Boulder County, which is a huge task when we talk about public health. So we just really appreciate that. I did have a couple of questions in the pre-read when you're asking about what might we get through. So I don't know how the process is going to happen at the meeting. So I'm not going to wait for a review of each document. I was interested, it may just been the way I interpreted the packet and aligns with some of what I heard folks talking about already in the introductions, what unfunded mandates may have occurred in this legislative session that I'm not aware of. So just kind of in preparation, that would be helpful. And also, if you and Commissioner Lee and I were just in a Commissioner and Counties Acting Together conversation, talking about what else is happening, what's being talked about right now. So anything like that might be helpful for us would be interesting. And then also just I'm interested in the priority budgeting process, and that somehow that might be a more internal and offline conversation. But since the county, for the board members who may not know, Boulder County Commissioners are also leading that work with OFM for our side at the county. And so just to see this in the packet, I was like, oh, this is great. So just to have an understanding if there's any lessons learned or anything that we need to be thinking about. Of course, with our members for today at the table as well. So those were just a couple of pieces. I'm very interested in continuing the communication and the partnership, and I appreciate folks making time. It's hard to get this many people together in a room, period. And so looking forward to hearing from you all on how this continues.
I'm Amber Johnson and the board members. I'm celebrating my 3rd year on the board this summer. And I feel fortunate that I feel like this 3-year stretch has been the transformative piece that we keep talking about. And so I feel fortunate to have been here during these changes under the leadership of Lexi. One of the things I'd like to talk about is to reflect on some of those changes. I feel like a lot of the improvements that we've made, whether through priority-based budgeting or our work on strategic priorities, is that we've been able to move from a reactionary to a proactive stance in public health. And in that stance, I'd like to better understand the priorities of the county commissioners, right? Now that we have the luxury of thinking ahead, and now that we have the luxury of projecting where we should be in 1, 3, 5 years ahead, we'd love to consider your priorities as we're making those decisions. I'm interested in other ways that we might be able to communicate and partner. Like this once a year gathering is lovely, and yet I do think that there's probably more opportunities for us to better understand, the work that you all are doing and how we might create synergy and so those ideas and how we can do that without creating an extra burden for the commissioners and for the board. One of the things I wanted to bring up is that I don't want for us to lose all of the great work that's been done in mental behavioral health and equity. I feel like Boulder County Public Health is a very innovative organization and we're very forward thinking. And yet in the current climate, those are things that are quickly, easily lost. And so one of my priorities is being sure, even in the current fiscal environment, that we're not letting mental health and equity work fall by the wayside. And to the point of appointing board members, which maybe there'll be opportunities in the future. Thank you for Stephen. He's been lovely. He's been a great board member for us. And I think he's brought a perspective that was lacking on the board. So looking forward to continuing to work with him throughout the year.
Landry?
Hi, I want to echo everyone's sentiments. I've been on the board since 2019 and I apologize that I can't be there today. I am looking forward to the dialogue and working with everyone. I'll keep it brief so we can get started, but thank everyone for all the work that they're doing. And it's been great to have these meetings so that we can connect more in person, even though I can't be there today. So thank you.
Right, thank you. Yeah, I'd love for just
Lightning
going
round?
Yeah.
Janet
lightning round.
Peterson, County Administrator.
Lexi Nolan, Director of Public Health.
Joel Wagner, Director of Administration and Finance, Public Health.
Desiree Katsarozian, Finance Manager.
Sarah DeBoer, Senior Budget Analyst.
Mondo.
Oh.
Still, yeah.
You feel like Madonna?
I like routines, the process. Armando, I feel that Chief Financial Officer.
Indira Gujrali, she, her pronouns, and I am the Deputy Director.
Oh, it's me again. My name is Kelly Inch, he, she, her pronouns, and I'm Strategic Initiatives Director.
Patrick Cannell, Executive Administrative Assistant.
Tessa Hale, Public Health Policy Analyst.
Rachel, our Environmental Division Manager.
Dr. McCabe, Family Health Division Manager.
And Stephanie Farron, CETA Division Manager.
Natalie Springer, Commissioner's Deputy.
Wonderful. Thank you all so much. I did take notes on things people are interested in, and if we have time, and we'll try to have time, maybe we can hit a few of them at the end of the meeting. And of course, if not, I'm very happy to follow up after the meeting. Next slide. So,
Excuse the interruption.
I'm
Are there
sorry.
any staff online?
Oh, I can't see that far. Thank you.
Oh, yeah, we do have a couple staff online.
We have Mitch, we have Elise, and Jerry.
Hello,
And
Ms.
Jerry.
Goodwin, Budget Office.
Hi, I'm not sure if you wanted introductions, but Elise Wallen, Health Planning and Evaluation Manager.
Thank you, Elise.
Good afternoon, Jerry Meal, Budget Analyst.
Thank you, and thank you for catching that. Yes. Okay, great. So what we had thought we would do today was we really want to think about supporting alignment between BCPH and the county on the role of Boulder County Public Health in advancing health and well-being in Boulder County. Familiarize you all with the status of our agency budget spending and reserves. So fiscal will always be with us. And also share some updates on how we've advanced our governance practices inside the agency. I do want to really thank the Board of Health before we get started, because this has become a much more collaborative process than it used to be. And I think it's been incredibly beneficial for us. And we'll talk more about how we have started to work together in some different ways. But I feel like our relationship with the Board of Health has really gotten a lot deeper. So in terms of the agenda, we'll go through the agency vision. And for some folks, this might feel new. It's really not. It's expressed in our strategic plan. It's an amalgamation of all of the things that we've been talking about for the past few years, kind of put into a framework. We'll talk about the strengthened governance, the program alignment with county priorities. We'll talk about finance and budget, the impact, and get a little glimpse at our early KPIs, and then time for discussion and closing thoughts. So I will start us out with the agency vision. So for anyone who is unfamiliar, our mission at BCPH is to address social, economic, and environmental conditions to ensure that all people in Boulder County have the opportunity for a healthy life. And our vision is that Boulder County is a socially just, inclusive community where physical and mental health, social well-being, and the environment are valued, supported, and accessible to all. And this, I mean, you know, it sounds kind of typical, and there is a lot that is embedded in these statements, a lot that is implicit. about how do we get to this kind of a vision. Business as usual in this world that we live in will not do it because our world does not take us naturally towards that. It takes us in a different direction. And so public health's job right now is to find the ways that we can resist that tendency and put in place the systems, the thinking within our community, and the resources to get to that vision. And there's no way in the world that public health can do that by ourselves. So we've been thinking a lot about what does this mean. Next slide. So what would it take? Well, there's some very obvious things that it implies. It implies a focus on health, justice, and equity. We cannot achieve what we're trying to achieve in terms of the well-being of the community, in terms of the prevention of inequities, unless it is embedded. We have a theory of change that I'll talk about in a minute. Those two things are both expressed in our strategic plan. Our focus recently has been on really getting clear about our program goals, roles, and responsibilities, and how do we think about service levels in a resource-constrained environment. That work has been really supported by our priority-based budgeting process and our agency performance system. And then in terms of resources, how do we really maximize the resources that we have and that we find in the community? And that kind of combines all of the previous and also some other components like internal governance. I will just take a pause to say that I am forever grateful to live in Boulder County. I moved to Boulder specifically because I wanted to work for a government that was on the side of the people. I moved here without a job. So I didn't know that I was going to have a job where I'd get to do that. And the privilege of being able to kind of dream that way after coming from Texas is not lost on me. It was hard to work in Texas. If you did anything, you were improving the situation. If you just talked about doing something, you were improving the situation. And it's a little bit of a double-edged sword here in Boulder County because we are all really focused on this stuff across departments, way outside of public health. Talk about social determinants of health. Tons of people are paying attention to how their work impacts health. It's remarkable. It's because of a long history of leadership in the county. And what it's forced us to do as a public health department is really have to think much more carefully about where we are putting our resources and what is the lasting legacy for public health specifically. What is our niche in this county for advancing this vision? Okay, so I want to talk a little bit because the theory of change that we expressed in our strategic plan is really part of the culmination of, unfortunately having a director that really likes to think about philosophy and ethics and things like that, and having the opportunity to have some control over some resources, right? We all like to enjoy that bit of opportunity to dream a little bit, but how do you turn that vision, how do you turn those daydreams into something that actually makes sense, that is evidence-based, that we could actually accomplish? And so our theory of change includes three elements. First is we really think that we have to have a culture and a narrative that is centered on equity and health justice. And what I mean by that is not just talking about this is what's happening in our community. We had this many cases of disease. We're seeing a problem with this population in mental and behavioral health. It really forces us to talk about what is creating problems in our community, what is driving issues, why it's unfair, how it impacts everyone in the community. There's no justice for one until there's justice for everyone. No one's free till we're all free. And getting into a practice of being confident about speaking to these issues in a public way. That doesn't mean we lose our evidence base. It doesn't mean that we lose any of that hard edge, but we have to be able to create some spark in the community about why this is important and how it affects people, how it affects you as a community member. For a lot of different reasons, because we have to be able to, next element, focus on influencing and building systems and infrastructure that promote equity and health justice, including policies and practices that dismantle systemic barriers and create equitable opportunities for all. So when we see, I mean, you know, the fact that Boulder County has a minimum wage that is approaching a living wage is fabulous. It's exactly that kind of thing that we're talking about. And we see those seeds being planted in the county. And so part of our work in public health is to see what is our contribution to those kinds of system and policy changes. And we've done a lot of that work in the past. We have a lot of our innovative work has landed there. The sugar sweetened beverage tax was an opportunity to discourage unhealthy eating habits and the injustice of targeted advertising and a whole lot of other very difficult, complex social issues mixed in to also create a little bit of a financing circle that we could actually use to address some of the issues that we were seeing in the community. So really getting into the systems and infrastructure is about prevention. It is about how do we prevent, because every policy is, or lack of policy is a decision that we choose to make. And when it has an impact on health, we need to recognize that. We need to recognize that this is affecting the health of the community. And so when we can identify spaces where that kind of recreation of inequities is happening over and over in our society because of the policies or lack of policies or because of the systems that we've put into place, and we can elevate that and find solutions for that, I think it's incumbent on public health to do that work. It is an important ongoing investment because when you make that change, you not only capture the savings of everything that would have happened downstream, but you create a forward force for that to be prevented in the future. Okay, so the third component is really institutionalizing community engagement and supporting community action through genuine partnership and community ownership. It is both a means and an end. Our work is better when it is part of a larger conversation with the community. We know better about what people will appreciate and value, what's important to them. Public health is a really hard place to make strong public arguments sometimes because everybody's got a million other priorities besides public health, right? And you don't care about it until it's an issue. Public health works best when it's not seen. And so how you create relationships in the community, it's only going to work when you have consistent relationships. It's very difficult to advocate for public health if there's not a crisis at hand. And competing with all of the other, I mean, you as commissioners know this, right? You have a million other priorities going on. So part of what we have to do, both to help democratize the process, to keep our goals in alignment with what the community feels they need, and to be able to kind of generate the momentum around those issues in conversations in the community, in collaboration, is really to be very intentional about institutionalizing community engagement. Now, community engagement is something that our agency has done for a long time, but it's been very kind of spotty, a little bit siloed in different places. Teams do it very well, but they often do it very differently. And what we've been embarking on is a much more intentional effort to think about how do we do this work without burdening our partners, making it more of a value for them to want to participate, making sure that we are using our unique resources to be able to support them in what they need to accomplish, and really make it a much more bidirectional relationship. So that is the pathway that we think is going to be critical to achieving that vision. So I'm not going to go over a lot. Next slide, please. I'm not going to go over a lot of the good governance stuff because we'll saw it in the pre-read, and I just want to cover a few things specifically as they relate to county priorities. So on the left, you'll see the county priority on good governance and kind of the components, and then what you'll see under each of them is are the programs that and efforts that we see related to those county priorities specifically. On the right, you'll see some additional work that we've done. Maybe some of it could have been folded into the county priorities, but just wanted to call it out as other spaces where we have done work. We think accountability is, especially for BCPH right now, that has been a big focus for us the last couple of years. The infrastructure and policies, including fiscal controls and things like that. And then also really paying attention to how do we meet regulatory standards and mandated work as a part of good governance. And we're just going to take a little extra minute to talk about the culture plan because this is something that was developed last year and we were rolling out, and it's a little bit unique. Indira Gujral has been leading this work, and so I'll turn it over to her to talk about it a little bit.
Yeah. So I think it was actually a conversation with Armando last fall when we were doing our priority-based budgeting and we were starting to enact everything. And I think Armando said, you know, we really need to reset the culture. And I had attended the Fifth Stone Collective. The county provides support for us to attend the Fifth Stone Collective cohorts, which really talked about how to embed equity into your culture. And we know that from the literature, it's well known that you can have the best strategic plan, but if you don't have the culture in the agency to support it, you're not going to be successful. And so Armando and myself and the whole management team worked on having a series of conversations, everything from workload to reviewing our GARE surveys, to reviewing our internal employee surveys, to focusing on what is it that we want to do. And the main point that I got out of the Fifth Stone is that it's actually the leadership's responsibility to set the culture, and that if you don't set the culture will be set for you. And so we, as a management team, took a look at what we had been seeing through our data and what we had experienced over this past year, and we came up with these 6 initiatives. So the first one I'm going to talk about is inclusion, bridging, and belonging. We do a really good job in this county on inclusive hiring. We are all devoted to equity and diversity, and we also have a little blind spot on the inclusion side. And so what we found was that we wanted to make every person in this agency feel included in the work that they do, no matter who they are. And so we initiated some inclusion, bridging, and belonging activities, including monthly heritage months that really address different backgrounds and perspectives. One of our board members actually served on the last one for the Asian American Pacific Islander Native Hawaiian one, and that was great to hear his perspective. So we started that. Those will evolve into more equity-based, equity in action, where we're going to highlight some of our programs over the coming years to talk about how people are working in water quality and how they're integrating equity into their work. The other one that we talked about was uniform supervision. With the labor relations, we partnered with them to have them come in and teach everyone, all of our supervisors, what does it mean to have a union? How do we support people who want union representation? So we have started to make sure that every supervisor is informed and knows how to support employees with union representatives. We have also had our human resources group come in and teach us about the importance of uniform supervision. And we have done things like standardizing. We don't call them PMIs anymore, right? We call them check-ins. But we have standardized our templates, making sure that supervisors are asking all the key things that they need to be asking every employee. So we've done a lot of work in that space.
I just want to raise one issue related to that, that I know that the commissioners will be interested in. We have also been very clear with staff about what the expectations are on supervisor training. To try to really kind of strengthen their attention to coaching their staff, to holding their staff accountable, to really kind of tightening up some of that space.
And what their responsibility as supervisors.
That's right.
We're also engaging in healthy conflict navigation so that we can reduce the amount of conflict and handle it at the lowest level. So we'll be rolling out some techniques to support not just supervisors, but also staff on how to navigate conflict. I'm really proud of our Health Equity Coordinating Committee who developed a learning and growth plan. Big shout out to Carol Helwig, who really took the idea of doing racial equity and turning it into policy. How do we integrate it into the work that we do every day by creating this learning and growth objective that requires all divisions to have a learning and growth plan. It requires employees to have basics like unconscious bias and understanding microaggressions. And so all of those trainings are built in for every division and will be, every division is building their plan and then they will be sharing and celebrating that. And then we also have a culture of celebration. Little big shout out to Daphne McCabe, who's been really leading this. But each division developed a celebration plan because we know that we have to celebrate, even in the darkest of times, we have to celebrate all the great work that people are doing. So we are instituting a celebration policy. And we'll be making sure that there is celebration occurring in every division. There are some uniform celebrations occurring, and that we provide some resources for it. And then the big one that we have there is accountability. The accountability, when we took the culture plan to the supervisors, had a retreat with them in February, they said this is number one. So we are strengthening accountability across all of our systems, processes, and with each other. And we are also working on developing, one thing that we heard from the teams was we need to know who is making decisions when. And so we're building an accountability matrix and framework to support that. So this
involves a lot more documentation too.
Yes, it does. And I would say that this is owned by the management team and it is our responsibility to make sure that we accomplish all these key items. And this is a 2-year plan that we have. But we can't be successful with building all the infrastructure and building all the things that we're doing around strategic planning if we don't have this culture set.
Thank you, Indira. I just want to also say that the staff is actually pretty excited about this. They've been leaning into this project. So I'm excited to see what will happen with it and what our surveys will look like. We're going to start doing pulse checks, kind of just checking in with people about how things are going. So it'll be interesting to track some of those metrics too.
And our Commissioner Coachman, just so you know, the Health Equity Coordinating Committee was part of making sure that they had review and doing a react of this plan as well.
Next slide, Patrick. So this is the county's economic security and social stability priority. It feels very broad to us. So it felt like there were a lot of programs that fit nicely into it. I didn't feel a need to create a separate column, but really recognizing the relationship between meth remediation practices in the community and how that impacts our housing authorities. We have discovered over the last couple of years and continue to work with the housing authorities, not just in Boulder County, but across the state, on how to reduce the millions of dollars a year they spend on remediation without compromising any ordinances, state requirements, public health impacts. We are finding there's some much better ways to do the work that produce just the same outcomes. That significantly reduce housing costs, keep units online much more quickly, have turnover much more quickly during the remediation process, and that our housing authorities are very excited about. We've been working a lot with Boulder and with Longmont. So we will continue to report out on that as we work forward on that one. Resident self-sufficiency includes our maternal and child health home visitation programs. Particularly, they focus on resource navigation, healthcare support, skills building, food security work, children's special needs. And then we do continue to have quite a bit of work in mental and behavioral health with the infant and early childhood mental health consultation program. The Works program, SUAG, which is our community coalition. It has, I think, about 80 different organizations that participate, including the Sheriff's Office. The CSAP program, the Community Substance Abuse Prevention Program. It's very pared down right now, but we do have a couple of grants we're going to be working on this year. The maternal and child health home visitation programs also provide supports and connection to mental and behavioral health services, and then tobacco control.
Let's see, can I ask you a question? The children with special needs, what is that?
So, yeah, so it's important. Well, do you want to describe it, Daphne?
Oh, sure. Basically, it is a program that fits a gap between what the insurance companies and once somebody's purely established with Imagine or with ANI Avenues, and that initial diagnosis. So we do the NICU to home, for instance, and we have nurses and care coordination and resource coordination, but we are really a warm handoff between, oh my gosh, my child got a diagnosis, or I'm having this major crisis happen, and getting people to the stability that's the long-term resources. So anyway, that's the best way to describe it, as a gap. Philip, go ahead.
And the federal maternal child health block grant requires what, 60% of the funding?
Yes, that's
to be
right. the maternal
dedicated
child
to
health.
that program.
It's funded primarily from the feds, and it's throughout the state of Colorado, there's an allocation based on the population that we have.
Okay, I didn't know about that.
It sounds simple, and it's actually an incredibly impactful program. It hits parents when they are feeling at a loss, when they have multiple stressors, when they don't know how to navigate a very complicated health system for that particular kind of problem. And often they need additional supports that haven't even been identified.
And we have a wait list.
Yeah.
And we also get funds from the IBD that help. Anyway, thank you.
Next slide. The last area is climate action, environmental stewardship. Most of our work in that space is around the Valmont cleanup and the S-Tax funded water justice initiative. And then we do have some additional BCPH pro health environments work in our air quality and mosquito control and vector control. Next slide. Okay, so when we talk about maximizing resources, there's kind of three ways that we kind of have thought about it, and we're increasingly incorporating them into our thinking. One is really about return on investment, specifically investing in programs with known savings to communities or public systems. I mean, this is kind of all of public health. Public health is about prevention, which creates savings down the line. The cost of the program has to be compared to the savings. And so that's one way where you might see variation in the return on investment. But we absolutely see some spaces where the return on investment is pretty huge. One of the biggest ones is adverse childhood events. It's one of the reasons why prevention of child abuse, making sure children have adequate caregiving, safe environments, it's really critical. And that is not something that is unique to public health. Our human services partners do work in that space. That's one of the most important things you can do to create healthy adults and lifelong health. But there are a lot of areas of public health where that prevention really creates an important return on investment. The challenge, of course, is that the savings that accrue don't necessarily get reinvested into the prevention work. It's not a holistic economic structure. So to be able to first be able to document, to create the evidence base for it, and then to be able to find a way to actually create a closed loop economic system is a real challenge. Second area is really about going upstream. So this is also about prevention. It's the policy and systems change work. And these are some of the areas that we are working on at the moment. This is an area that we wanted to specifically focus on. Boulder County Public Health has a long history of having innovation in this space of local policy and systems change that has spread to other counties, is being looked at as, state initiatives. Rachel Arndt led an enormous amount of that work. Tessa Hale participated in a lot of that work. And we just felt like it's not just something that that we have developed skills for and relationships for, and that we happen to be in a county where there's a lot of political will to do this kind of work. But it also kind of sets a standard for other counties. And our work has been picked up in lots of places around the United States, and we want to continue to kind of build on that. Okay, next slide. Leveraging and joining resources. So this really starts to speak to the community engagement work. We want to think about, like, how do we not just kind of help each other and get information from the community, but really start to do that deeper engagement process, not just to benefit our work, but also to support their work. One of the ways to do that is to really identify groups that we have aligned goals with, so that we can feel comfortable leaning in and building trust, particularly in those specific areas, but also solutions that solve multiple problems. Like, for instance, the work of the HEAL program that's supported by the STAX, connecting local agriculture and climate work with food security. I mean, that's a brilliant connection. We want to see more of that kind of intersectoral work. And then I would say the last piece is, in terms of leveraging resources, we have a lot of staff that are, have a lot of different skills. And as we see kind of reductions in teams, what we're seeing is a lot of spaces where there will be a surge in the need for staff during the year. It's not continuous, but there will be these moments where the team is just very overwhelmed. We want to identify how can we use staff that have those skills that may not be located in that department. Epidemiology is a great example, to reinforce those teams. Now that presents a little bit of an administrative workload, because we have to figure out how does this incorporate it in people's job descriptions and things like that. But I think that that's something that we can get through, but really trying to think about that, as well as how do we think about when we have to reduce services, how do we think about using risk assessments to focus in on what we think is the most important work to continue public health risk. And then in terms of innovation, as I was kind of mentioning earlier, that proof of concept for broader uptake, the IEC MHC program. We're going to launch a baby cafe soon, which is really a social connectivity opportunity for a lot of our new mothers that should be self-sufficient. Our works program, is the third in the country. It is still going strong and providing a lot of really great outputs and outcomes that were reported on. The Vape Aware program is very innovative, was recognized nationally by the EPA a couple of weeks ago. And then, of course, our sugar sweetened beverage program. And then, so the idea is that some spaces in innovation, you want to do a proof of concept, and then you want other people to kind of pick it up. And there's another approach to innovation where it's really about do the proof of concept, but then spin it out, have somebody else do the work for you so that you can actually use the funds for something else and keep that cycle going. And we've had some good experiences in that space in terms of spin-off, moving to new goals, or generating sustainable funding. So the Oasis and Generations program, which we sunset last year, our intention, because we did that because there were organizations in the community that were doing that work. And our intention is to continue to do related work, but in spaces where they aren't doing work that needs to be done. So the add-on opportunity. In terms of Family Connects, we are working on finding a sustainable funding system by actually getting Medicaid to cover those services for those parents, which would also create a funding flow that would make this program very attractive to hospitals to incorporate, and we could move it into the hospital systems. And then finally, Baby Cafe, I think we're still working on what the return funding flow is, but it's very inexpensive. It seems to have some good outcomes initially, so we'll be tracking that one as we go forward. Okay. So moving, kind of what we've done is we've moved from kind of a collection of programs to a much stronger holistic vision and strategy about what is it that we're trying to do and how do we do it. Understanding the contribution of the work that we do, becoming better stewards of our resources, and really putting people at the center of the work, both internally as we practice. What does it mean to be anti-racist in our thinking and our policies and our interactions inside the agency, and how does that play out as we go out into the community? So, next slide. Just a few questions for you all. What do you think? Any impressions? Anything missing? You think this is a good pathway? What should we change or improve? What are y'all learning from other departments that might help us?
Happy to jump in. Let's see for the presentation. I think one of my initial curiosities was and appreciate the lineup with his strategic priorities, and also for the board who may not, that the county commissioners are right now working on our next set of strategic priorities. We're in Boulder County, our values are pretty clear, and we are going to have some changes out. So I was just curious about in that plan, if you just had kind of lined it up to think about the work that we're all doing, or if there was a time period on that work versus the cultural plan. I heard a 2-year timeframe. So it's just a curiosity and also something for us to think about in the timing, so that we make sure that we share that with you all too when we get through the strategic priorities.
So I think the first iteration, because that was the first time I'd seen county priorities rolled out, the first iteration of the analysis was really, does our work align? It was that question, does our work align? So trying to get just a little bit of handle on that. What I'd love for us to move towards as the next priorities of all is not just what aligns, but what are the opportunities? So it gets into that kind of leveraging resources space. We want to be more connected in the county where it makes sense. And I think we invite kind of that conversation about where are there real efficiencies to create economies of scale, to multiply the work. Yeah, so that would be great to have a continued conversation about that.
I guess that's a clarifying question for my own understanding. What is the planning cycle, and kind of when are you guys updating your? So I think some of this is just synchronizing potentially timelines a little bit more.
Yeah,
proactively.
sure, absolutely. We're working on the strategic priorities right now.
Yeah.
And previously it was a 5-year plan. We have a 3-year plan, talking about 3-year plans.
Okay.
And we're not changing, the 3 priorities are gonna stay.
Okay.
We're really looking at like underneath each of those, do we want to shift focus? What do we want to keep? What do we want to change? So I don't think we're gonna see big changes there. I mean, certainly the 3 we've already decided are not gonna change.
Can I add something really quick? So one of the things that's important is we have a 5-year strategic plan. And next year we'll be starting to plan our community health assessment, which would be the year after that. So having that, when we did this particular strategic plan, we used or coordinated with the county's work when they pulled together things around mental and behavioral health. So we use some of the data from that space fact, it was a key part of the data that we used in order to develop our public health improvement plan and our strategic priorities in this space. So I think that there's alignment when we'll be looking at, when we go through another strategic planning process to look at our own strategic plan and what priorities we want to set going into the future. I think we'll be very close line to one another in that particular space is timing wise.
And we're mandated.
I was gonna say, I mean, I
We are
feel like this
mandated,
takes
yeah.
a second to just understand. We are mandated to do a community health assessment every 3 years, I believe, and that's state mandate. Then we're mandated to do a public health improvement plan also.
Every 5.
And then we have our own strategic plan. So it is a little, it's hard for the board to keep track of. Honestly. There are so many plans and it is not my favorite thing to spend so much time doing all these various plans, but that is why we're doing 3 separate plans, is because 2 of them are mandated. We try to make sure that they're aligned. So.
And I think if you're doing community outreach, it would be good to know when you plan to do that, because then we might be able to collect information at the same time. You know, with partners that you may not work with, like hospitals, healthcare. So, and I see Elise has her hand up.
It was just a minor clarification. Yeah, our CHA and our public health improvement plan are mandated. They're mandated for every 5 years. I think I heard that the CHA was every 3 years, but both are mandated that at a minimum, we do them every 5 years. We could do them more frequently. It's just a capacity concern.
I do also want to say, I think, you know, when after we got the ARPA funds and the county decided to do a community-wide needs assessment, I thought that was fantastic. And I also see opportunity for working more collectively on community needs assessments going forward. So that is very welcome. Go ahead.
One thing I would like to collaborate on, and I'm not educated on at the county level what is happening around AI strategy, but this is top of mind for me as sort of a next phase and discussions with Lexi and the team, which is how are we thinking about AI and AI enablement from a lot of different perspectives. And I'd say no, literally like enough to be dangerous in terms of where the county might be going and some principles that the county is establishing. But I would like to, again, maybe we can take that offline as a follow-up, just to, you know, make sure that we're engaged and that we're incorporating. I don't think we're really talking about an AI strategy actively as a board, and I'm sure there's some things going on internally, but I'd like to pull that forward as a pretty clear strategic priority for the organization.
Well,
Yeah. I can also talk to you offline, Lindy. We are coordinating with county IT in this space, and we're looking at an internal policy that connects well with them, but we can talk to you about that.
Yeah, and
County
it-
IT's been very
it's
good with us.
strategic, but it's also the enablement part, like how are we thinking about the pull through, and then are we setting targets? Are there things that we're establishing in terms of goalposts for AI? Anyway, I think it would be an interesting area to collaborate with the county on to understand kind of how we collectively are looking at that issue.
One of the most important opportunities that public health organizations have identified across the country is really the use of AI for coagulating data from multiple sources and really being able to do things like a community needs assessment in a much shorter period of time so that we can spend more of the time in implementation and on other projects, because those are spaces where we're understaffed and we're never going to be able to do as much as we want to if everything continues to be as manual as it is. And it's a space where National Public Health is really leaning in. So I'm curious to see where they're going to start taking conversations.
So Lindy, when you mentioned AI, I also, my mind went to the public health impacts of AI. And I know public health did do some work in the space of youth and social media. And that was a big push, I think, for a while. And so there's the side of it that can help facilitate the work and make it more efficient and quick. And then there's also the environmental, the environmental and public health impacts of AI.
Absolutely. I think that's really critical. I think that's starting to actually pick up some traction in conversations. I think when we are able to have a bit more data, it would be lovely to kind of think about how do we incorporate that into a governance, a set of governance policies and practices in terms of like, when do we use it? When is it really important? When is it maybe worth the trade-off? when do we not use it? I think there's a real danger of overusing it because it's being kind of pushed down our throats right now. Like Simone mentioned the other day, when you go to Google, it automatically runs the AI. It's like, can I turn that off? And then also thinking about, the impact on other communities. It's not necessarily that those impacts will accrue inside Boulder County. They will often be pushed to poorer counties, to environmental justice communities, to other, just further exacerbating inequities for those communities. So I think that's really an important.
And the school districts are certainly thinking a lot about the impacts on mental health. So that's another working with school boards too on that.
But, if, they talk about the epidemic of loneliness.
Yes.
That seems like that's in your alley, that just because it's an aspect of community health. These things hit kids, they hit adults. When your best friend is a backpack, then we've got a problem. And, there's not an entity whose mission is to address that, other than, for me, it seems like it's public health.
Actually, that is something that we've been talking about as a strategy, really leaning into the social connection piece. And what does it mean and who are the most vulnerable in that space? Because it's not always the same people. I mean, older folks are extraordinarily vulnerable to the social isolation issue. And depression is massively underdiagnosed in older folks. Once they get into a cycle, it's, no one's paying attention to know that those things are happening to them and to offer the assistance because the isolation is the problem.
Yeah.
So I think that's really important. Yeah.
Although it can be a benefit too. I mean, if you're lonely and you don't have anybody, and you can create a that can provide some stimulus.
I see.
Not only that.
I think I know I'm stating now, this is such a rapidly changing issue right now in front of us. And I think it's Claire, the issue you're raising, which is, I think we need to be clear as an organization with what we know today, right? Where we stand in our policies on AI and how we're thinking about it as a community as it relates to public health, because it is, I would say nobody's an expert on this. It's such a rapidly evolving thing. And it really, truly is everyone's remit to figure out how this can benefit an organization and how it can also potentially not benefit an organization and the communities that you serve. So it's sort of like the call to action. I think it's really incumbent on all of us to figure that out. And then it changes, right? So it's the evolution of this, and how do we stay on top of these things to make sure that we've got points of view and a strategy, but also an execution plan around that.
We were on a call this morning with the state, and they were talking about cybersecurity is now the problem with AI. Their public health, the national public health groups are worried about how we collect our communicable disease data, and that they're now tightening everything because these AI bots hack into your systems. So I think you're right. It would be great to have some kind of AI czar of some sort to, help us navigate as a county to get through.
I want to go back to the questions, and Marta, I don't know if you finished with you kicked off our discussion, and I was going to pick up the baton if you were finished.
Oh, okay.
This is actually maybe not a direct response to the questions, but a thought as you were talking about maximizing resources and the ROI concept here, that the benefits don't accrue to the entity that's expending the resources, and that's kind of a common problem in government. And so I think I guess I prefer a different framing that isn't really, what's the ROI to Boulder County Public Health as an agency? It's an ROI to society.
No, that's exactly.
Yeah, and that's why it's difficult, why you can't capture it. But the things that are listed here in, what is this, like 3.5 font?
Maybe go back a slide.
This one.
Maximizing resource.
You know, that just taking the adverse childhood experiences, or any of these really, that they, you know, that public health is about a healthy public. And that's what this is for. And that's why we fund it out of public funds. So it's, you know, I think I just would frame it all differently.
Maybe. That real, I've, in my very short time here, I've met several people who are beneficiaries of public health programs from decades ago who are now working for this agency, and they are bringing new ideas and new value and innovation to this group. And I think that's just exactly what you said, just in a really concise example of people who were beneficiaries are now working here and driving the agency's mission.
Yeah.
I think, Claire, one thing I would just add to that we've been having pretty healthy dialogue on as a board and with this team is, and I'm very much a data-driven, you take an action, what's the outcome kind of thinker. And I think what we've really pushed the team to think about is, it's your point, like, how do we, at the end of the day, say that we've made an impact, right? Like, that's really important. Otherwise, what are we, So I think the team's done a great job moving down that path in a more clear way to start to define performance indicators and things like that. And I'm not talking about just in the agency, I'm talking about the ultimate impact on the community. And I think that as with everything you measure, it's difficult to define some of these measures, right? Because there's interactive effects in a community environment, like what the individual impact you make as a public health department may be amplified by other things going on out in the community or the other way around. And so I think we have to be data-driven, but we need to be clear about how we're defining the measures, right? And that there's some to some degree, it's not a science. There's some level of imprecision around what we're doing. So that's something and I would say we're on a journey on this, and we actually have developed a subcommittee, and Amber can speak to this way more eloquently than I can in terms of thinking about our strategic planning, how we're linking that to performance management, and showing up in the right way to say, yes, we have made an impact, and we can measurably go back and talk about that. So I'd say this is an evolving conversation, and I just wanted to sort of share that context with you as we continue. I think this is kind of our next big hill to climb as a Board of Health. And as we left priority-based budgeting, this was kind of the next remit of the organization, which is how do we better capture value? But it's, again, it's not value to this agency. It's about community value. So,
well, and I just want to remind everybody, public health serves 330,000 residents. We don't just serve unincorporated Boulder County. We serve every single person. And we're not funded to serve every person for good health. So we have to focus. We have priority populations that we focus on. And each program often just identifies those folks that are the most vulnerable, at risk. What does the literature show us? Who should we focus on? Which families do we need to focus on? And that will tie in to the measures that we see that are being collected. And we have to keep in perspective that it's going to be a proportion of the population that we serve, not the entire population.
And also, I think, how do we communicate that back out to the community? Because I don't think anyone reads our strategic plan other than us. So I do think, how do we tell the story of public health and then government more? I think government is in a rough place right now in this country. Just that people are questioning the value in a lot of ways. And so how do we all work together to tell the story about local government and how it does touch so many lives on a day-to-day basis? And outside of a strategic plan, how do we tell the story of impact from the investments that are made in our community? So that's another area I think, we have made commitments to our own communication program, but it would be great to continue. And I know there is better collaboration, I believe, with the county right now on communication, but But I think we can all work together on telling that story more effectively in the places where people are getting their media now, which has also evolved.
Yeah. And that's what I think, Lindy's point about collecting that data is really gonna help us tell that story.
Hey,
Yeah.
just to weigh in also, so I just sort of want to start by saying something that everyone in this room probably knows, is just that Lexi, you have a very good reputation around the state with other public health agencies and other counties, and I'm always getting kudos about Lexi at different conferences and from different people about how impressive she is. And just getting to sit and listen to your presentation, I was sitting here feeling like this is very impressive. Like, it is wonderful to hear you talk about the different aspects that you've been working on. And I was thinking a couple times, like, we should clip it and put it on PBS or something so people can hear you speaking, because it really is inspiring. So you've earned your reputation that precedes you, and it was very wonderful to hear you speak. And I also a few times was noticing like how sober the room is versus the content we were discussing, and it felt like a mismatch to me. So just like very inspired and impressed, even though the room is kind of not at the same vibe that I'm sensing from the content. So just wanted to share that I do think it's been a lot of hard work. That's probably the sobriety I'm feeling in the room. It's just the hardness of the work and the significance of the effort, but it is so much going in the right direction. And like, this feels on a very good track, and wonderful to hear your approach and the way that the board is going about it, the way the staff is going about it, just starting off with that. I have a very specific question, which doesn't mean I wasn't interested in the broad strategy of the whole thing, but just you had one particular thing on the slide for good governance where it said vector control was unfunded. And just a curiosity around that, like just with the mosquito, I took vector control to be mosquito control. And so maybe I misunderstood.
It's a separate.
Okay, separate from, okay, and is consider mosquito control as part of vector control, or you're just saying the rest of it?
We list them as separate programs. So mosquito is listed separately. The vector is really about the small animals and.
Okay, rodents, ticks, bats, other things.
Got it, rabbit in.
Okay, just
A lot of rabbits, yeah.
Yeah, and we're restricted in our mosquito fund
sure.
that we can't transfer that over to the other species.
for sure, and that it's complicated because actually the county is who has the authority to do the funding, and it's complicated. So I had a bunch of opinions about it, but I just wondered what those double asterisk meant. So it's rodents that you're primarily thinking about, and primarily in urban areas, or no, like all of them?
It's all over.
Yeah.
It's all over. We're working on updating the vector map viewers so that there will be more transparency when we're getting species. We also have a couple of partnerships with CDC out of CSU for some of the climate and how climate change will impact vector spread as
For
well.
sure. Okay, that's super interesting. So I'll learn more about that before we speak again, but that is great. Thank you for explaining that. The only thing I can think of to be responsive to this slide of other things like forward thinking, and this is probably somewhat informed by like how I was taking in the state public health's comments throughout the legislative session, the lobbying organization for the other public health, for the collective public health agencies. I just feel like, given the scarcity of resources we all face, government, public health agencies in total, I think we have to continue to think of ways to empower community to succeed instead of trying to solve everything for community or resolve everything. So as we have opportunities to think of how to do that, like what are ways that we can empower the community to work on vector control, whatever the topic is, instead of thinking we are coming to save the day. Because just to your points, we just don't have resources to serve every single person, and we can't go after every single rat. But there may be ways to empower people to address the rats. So
Ashley, can you give an example about how the county's thinking about that? Like, what are some things that you're thinking about empowering community to do?
so in the legislative session, there was a lot of debating around like different laws that were being put into place and whether they would allow people to better themselves within our strategic values, or whether they would whether it would create a regulatory framework that puts something upon us that we can't actually deliver. And so the one that immediately comes to mind for me is the tamale bill. I don't know if you guys spent much time talking about that. And we had different perspectives on that among the board. So I'm just only speaking for myself. But on that particular bill, like, I go to my neighbor's house for dinner. Y'all have never inspected my neighbor's kitchen, and I may or may not die. Like, and that's true. And that is sad. Like, you may die when you eat at your neighbor's house, or like my husband makes dinner for me.
The Australian woman who poisoned her ex-in-law.
Exactly. I could be, so, and no one has trained him. Public health has never investigated his ability to do culinary things, but we're gonna like have public health inspecting people's houses so they can sell a dozen tamales. I don't know. So you can tell where I came down on that, but I think figuring out how to empower people to make healthy choices if they're preparing food for others versus thinking that we're gonna be able to run around the whole state and look at every single person's kitchen in the whole state and make sure everybody's food is at the right temperature.
I don't think that was ever the expectation, but I
That
hear
was
what you're
where the
saying.
conversations went.
Yeah.
Like that was, and
Yeah.
there was literally an amendment to the bill that was like, we're gonna go in every house and
Oh,
inspect every house.
yeah.
That was literally,
Not supportive.
no, I. That was literally accepted in one of the committees as an amendment that was like, public health's gonna inspect every one of these individual homes, kitchens, and anyway. So I think
That's a great
thinking
example.
through how
Yeah.
to like empower people to make healthy food, how to empower
Yeah.
people to.
I mean, I'm curious about how the county and your programs, how are you all thinking about that?
I'm just saying an example in the legislature.
Oh, totally. Yeah, no, I guess I find it really interesting.
Yeah.
So I would love to, you don't have to say right now, but like, as you all are exploring how to shift
Yeah.
more things onto community
Yeah.
members,
We
what
do
does that look like and how's the process and how do you think about it?
We do it in transportation somewhat, to some degree. Like we have areas that we're doing it better than others. Wildfire mitigation is a good example of an area where we're really trying to empower the community to be able to mitigate their property. We can't mitigate every single property. So you see a lot of educational material, like a lot of it is focused on information.
The incentive structure.
And funding, right? Okay, that makes sense to me. I was just looking for like, what's a concrete example?
Yeah,
that, like,
some
you all are
areas we're not doing as good of a job, for sure.
trying-
And I can point those out too, but like, and even like with the incentive structure, focusing on, a lot of times we get emails from people saying, well, I'm redoing my deck, so could I have $500 for that? And I have to write all these emails back. That's like, we're really trying to invest the funding in a but for, like, you're doing your deck anyway. So you just have to do that to this standard. $500 isn't going to make someone go out and replace their deck with a non-combustible deck. It's just not enough. A deck is much more expensive. Same thing with siding. We get emails from people all the time. Could we have $500 for our siding project? It's like, I'm so glad you're doing your siding project. That's groovy. $500 is not going to incentivize someone to spend $50,000 on their siding. It's just not enough to make that leap. So how
You
we
can tear out some junipers.
you can tear out some junipers. That's exactly right. That's exactly right. So that's just something that comes up for me. And then I think you said, how could we improve? I do think, like sort of as all pointed out, we're meeting once a year, which is very infrequent. And so figuring out how to open the dialogue when we get to the tactical decisions, because it does feel like from the presentation, the strategy is very well aligned and the goals are very well aligned. But sometimes I think we miss opportunities when the staff are deploying the tactics to implement the vision, that there's not an open enough channel. So thinking through ways to do that seems to come to mind for me.
Right, thank you. Wonderful. Okay, thank you so much. We're gonna move on to finance and budget. And
Top finance.
welcome to Joel. We, of course, as in our tradition, we threw him right into the fire. He has learned very quickly in the last few weeks, so happy to turn it over to y'all.
Thanks, Lexi. Yeah, literally my first day with the budget study session, so I can take 0 credit for anything that's in these slides. I will remind you of the longstanding rule that you have 6 months to blame your predecessor for getting issued. I'm just going to say a couple quick words. So I've been here for 3 weeks. Previous to this, I was at the city of Boulder. When I was researching this job, I really was struck by the amount of work and quality work that this team has done in a very short amount of time to really right the ship financially, and how the team incorporates equity in every decision and every page of their strategic plan. And I was just really, really impressed and inspired and excited to have the opportunity to join this team and serve our community and hopefully make this community an even better place for everybody who lives here, and especially those who have been historically underrepresented. So that is all I'm going to say before I just say a huge thank you to Desiree and Sarah for all of their work, both in preparing the previous budgets, getting us through the year end, and getting us ready for 2027. To Desiree to talk a little where we are. Sarah, we'll talk about where we're going.
Perfect. Next slide, please. So Desiree Kazarosian, and I'm again the finance manager. So this is a overview of where we ended 2025 budget to actual. But Boulder County Public Health submitted its preliminary 2025 trial balance March 31st this year for review to our financial audit firm, Clifton Larson Allen. Public Health aligns with county audit deadlines. We work very closely with OFM on how we're doing and progress reports, questions, alignment. There's some entries that the county does for us, so we have to watch and see when those are coming through. So it's very much a partnership that we do our audit with the county. The underspending that you see here in operating is assumed to be driven by our continued conservative spending and reduction in staff beginning during the summer of 2025. So staff was very aware of the reductions that were happening. And so there was a lot of fiscal responsibility happening. So we are attributing that underspend to those decisions. For further analysis is on the understand spending of the operating will be done to determine the revenue source. And if those funds were flexible funds, can they be reallocated to address other agency needs? So we want to make sure that we are spending what we have budgeted, because if not, there may be other opportunities to spend those. All right, next slide. Thank you. It's, oh, yeah, thank you.
One spreadsheet looks much the same as another.
I'll take that responsibility. So you're gonna see on the left-hand column here that you're gonna see 4 appropriations. Public health has historically had PH 11, 12, and 13. We made a decision last year to consider having a grant-only appropriation. So the reason that we did this is the county, I believe it's Fund 117 is your grant fund. Is that right, Armando? So in having the grants sit alone, it allowed us to pull better reporting, especially in this time of funding constraints. There was a lot of questions how we were doing collecting our revenues, how we were doing on our spend downs, and we had them mixed in to our PH 11. So we moved all of, you can see kind of the different categories that we use of grants, Medicaid, per capita, and donations, and Medicaid is a federal grant. There was a couple other choices we made along the way. We decided to close PH 12. So the sustainability tax had gotten to a point where it didn't really justify having its own appropriation. So we mixed that into the PH 13. PH 13 holds all of the county funds that we get from you all, not just the transfer, but from other funding sources as well. And you'll see that later kind of broken out in more detail on some of the other slides. So that's just a brief overview of that. For our federal, our biggest fiscal cliffs, federal and state funding, the state implemented a policy in 2025 of not passing on federal funds until the state agencies have received the funds. So when we get a notice of award, it's coming with $0 if they haven't yet received it. So that really has caused some challenges in budgeting, and especially when we have employees that are dependent on those funds and how we are going about funding some of those gaps times a year. So the new administration, the changes seem to have slowed, but changes in federal public health priorities are expected to continue, although at a slower pace. So for us, our more stable funding sources are county funds and fees. We continue to budget conservatively, ensuring key agency and community public health priorities are supported with funding. And I'm going to pass this now to Sarah DeVore to speak on the 2026 budget amendment.
I'm Sarah DeVore, I'm the senior budget analyst. Excuse me. So this slide is a little bit more detail on our revenues. I took a note on the size. So I make sure I fix that next time. Clear it up. Look, pressure. So what we're showing here on the far left column is the revenue sources broken out a little bit more clearly into the different buckets. The first column is the adopted budget, which was adopted by our Board of Health in December of 2025. The adjustment is what led us to the budget amendment that was adopted by the board back in May. The real difference here you'll see is the increase in revenue. And that's based on a change in how we are recognizing our revenues on the grant side. So when we build the 2026 budget, we only recognize grant revenues for which we had a contract or notice of award for through September 30th. And that was a big change in practice for the agency. So what happened between the adoption in December or October 1st is we received quite a bit new revenue, about $1.7 million in grant funding that needed to be recognized. And those were state grants that started on a different cycle. Some of them were federal, some of them were local. It was a whole mix of things that adjusted that. And so we had notice of award letters and contracts through March 31st was our cutoff to recognize those revenues. We do anticipate doing a second budget amendment and that this will be a new cadence because as you all know, the state fiscal year begins July 1. And so we are in the process of working through those notice of award letters and those contracts, and we'll need to adjust and recognize that revenue again. But we felt like this was a much more appropriate way of budgeting going forward. Next slide, please.
And that was a culture shift for all of the supervisors and the coordinators managing this, but they have aligned well and they do understand how important it is to take this more conservative approach. Making sure we have all those notice of awards before we start counting on the money.
So this is one of Armando's favorite slides. It's our source and use that we have adopted in order to be able to see the changes. So that the top half shows you the financial sources or the revenue sources. On the left, you have the adopted budget in the blue column on the left. The blue column on the right is the adopted budget. I also want to give a moment of gratitude to Mitch for helping us work through this. So if you were to look at OpenGov prior to, I believe, last Friday, our structure would have looked as it does on the left. What Mitch and Jerry have worked through over the past week is moving all of the appropriations so that they match the new structure that Desiree just walked you through. That was a tremendous lift, and I just want to recognize their efforts on that. One thing you will notice here is that our reserve draw did increase from the adopted budget to the budget amendment. It went from 691,000 to 991,000. This was a change in methodology. When we went back and were looking at the budget amendment, what we realized was that there were programs that had revenues in excess of their expenditures in the adopted budget. And the way that the model worked and the way the policy was working through that system was that excess money was in the model. It looked like it could be reallocated to for other purposes, which it couldn't because it was dedicated grant funds. And so that was a methodology change. And so the adopted budget, our reserve draw was artificially low. It should have been 1.3 million, but it was artificially lowered because of that change. And so that was a methodology change that we corrected in the budget amendment, making sure that we only recognized the revenue that could be shifted throughout the agency.
So just being a little more conservative in how we're recognizing our reserves and making sure that we're.
It's removing the restricted grant funds from that effort.
Yeah, and I will say just to add some commentary to this, we discussed this in the budget committee and subsequently when we approved this with the board in a public meeting and, our reserve levels are still well within our policy limits. And so, that's something, and I'm sure we'll talk about it a little bit more, but something the board is very actively managing too in terms of our reserves and how we're thinking about that as an organization. But we felt comfortable that draw would be sufficient. Now, I will not be able to say the same thing in the out years, so we'll get there, but for now, it is looking like it's fine. So we were comfortable moving forward on the amendment.
Last point I'll make on this slide is the additional increase in revenue. When we budgeted for 2026, we followed a similar process as we did for 2025, that individuals who are funded with grants or who are term employees, we only budgeted them for 6 months, right? Because we only recognized the revenue through June 30th of halfway through this year. And so the money, the increase in revenues and grant funds was used to extend all but 2 positions with the agency through the end of December. That's a process that will continue. It's a little bit more stable, I think, than where we were about a year and a half ago. But do recognize that you'll probably see a lower budget when it's initially adopted by the Board of Health. It will probably increase. I wouldn't be surprised if it increases slightly again for the second budget amendment based on some of the preliminary figures we're seeing from the Colorado Department of Public Health and Environment. But that's about what I'm expecting. And so that just is a much more conservative approach to budgeting our revenues and making sure that we are only planning to spend the money that we actually have or are working towards grants and whatnot.
And Sarah, do you feel like this recent federal reconciliation contributed to our moving in this direction? I mean, because they didn't pass the budget till February.
I think this kind of goes back to how the agency, when I arrived a year and a half, 2 years ago, there was a thinking that we had always gotten this grant. We're always going to get this grant. So we're going to count this grant. And I think we all know that the world shifted significantly last January, February of 2025. And I think this recognizes that shift, but it also moves us back to fiscal stewardship and sustainability more consistently as far as how we're managing our grants. We are going through this process. We actually started this process this morning for 2027, making sure that we're all on the same page for what revenues we think we're going to be expecting. We'll continue that through next week.
What did you hear from your term employees that are looking at the budget with only, half a year's funding?
It was a lot. There were a lot of conversations. I'll certainly let Lexi and the leadership team speak to that. But one of the things I learned from my vantage point was communicate. And so I've lost track of how many supervisors meetings I've gone to. I hold biweekly office hours for folks to come chat with me on a staff level. But it is definitely very much about communication. And Commissioner, you were asking about lessons learned from PBB. It's change management. It's making sure that people understand the why we're doing this and how it's going to work, and then developing that calendar so that they have a sense of timing of what to expect and when to expect it. But I would certainly defer to the rest of the team to answer that.
I would say the first iteration, the first year of implementation of PBB is probably the hardest because you're changing so many expectations and processes and still figuring it out. I mean, I will not say we did it perfectly. I think we had our own lessons about the process that we are implementing this year, and we'll probably have some more next year. But I think that as the rhythm gets more familiar to staff, it will feel less threatening. But I will say I don't like the structure right now of having kind of a 3-month runway for term staff. I think we're trying to think through how do we not keep people so precarious.
It's terrible for them and it's terrible for us.
Right.
Nobody also wants to think about how do you manage someone for 6 months at a time.
Right.
Like that's not a.
Well, that's what, when I read the materials,
Yeah.
that was one thing that
Exactly.
stuck with me.
Yeah. If it is a grant renewal, then it's like a 5-year grant and we're in the middle of year 3, there is more comfort knowing that that is getting renewed. I think it got more scary last year. We didn't have a federal budget. We didn't know what was going to happen. And then that, of course, that money passes to the state. So that got a little bit scary. But if you're in the middle of a renewal, it feels safer and people seem to understand we're in the middle of a renewal. This is just the way the agency's approaching it. I think it gets harder when we don't get a grant and we're in the middle of the full approach. So we just lost the TGYS. We've had that grant for years.
$500,000 a year.
Tony grants us.
Tony grants it.
Yeah, I mean, it is like a talent problem too, right? You can't recruit good people if you can only guarantee them.
Yeah.
It's just that way.
So we try to kind of keep it as like we're in the middle of renewal unless Jared Polis declares a state of emergency and raids the tobacco funds or raids something, we're expecting those. So it just
So part of what we've been doing is kind of looking at the grants that we've applied for or would be on the books and kind of ranking them according to this is high risk, this is medium risk, this is low risk. And then also figuring out what that means in terms of staffing.
Well, and I'm curious, just listening to this conversation, do you guys also message around? I mean, we are clearly like very tapped in terms of resources right now, right? And we've got all hands on deck. So is there something around the kind of performance management system, Lexi, that I know you've been working on in terms of transferability of skill sets to other areas of the organization and having some fluidity? I mean, obviously the organization had to do this during COVID, right? And I know we talked a lot about readiness of the team to be able to deploy into different areas of the agency as needed. So I wonder if that's also part of it, which is,
It is.
Yeah.
Yeah, and I don't know if you want to talk about the community health restructure now, but we can like share that as an example.
sure, good.
So we are, because of the Tony Graham system, we're moving from having 4 divisions down to 3 health divisions. And so the community health division, which has been in place for 40 years, is getting integrated into the family health, the communicable disease and emergency management, and the environmental health team. And we do have a couple staff who have we're transferring their skills into other programs where they can use their skills in those spaces. So of course, obviously, this went through the county attorney's office, went through labor relations, it went through HR, and it has been a pretty smooth process. But it is, to Sarah's point, all about change management, communication, making sure that people can have the opportunity to ask questions. And, this is where we're at, where when we don't get these funds, this is the kind of decisions we have to make.
Next slide, please.
I watched that time. So this is our comparison year over year of the reserve draw. You can see on the far left, we have our 2026 adopted budget, and then we just amended our budget in May. So there's our 2026 amended budget, and then 2027 and 2028 forecasts. So I'm going to go ahead and read the script here, and then we can answer any questions. So the adopted budget, the reserve draw reflects the adopted budget per the resolution. That the second, which is the amended budget, it shows the corrected reserve draw as it is projected to increase to the 991,000 from the adopted budget of the 691,000. The increase between the adopted budget and the budget amendment is anticipated to be a recurring revenue adjustment, as Sarah mentioned, as the agency reflects revenues in the adopted budget based on the notice of award letters and the contracts as we continue to strengthen our fiscal policies. So 2027 reflects the budget amendment for 2026, adjusted to reflect the reduction to the reserve by 300,000 and a 20% reduction in federal grants, which is our more conservative approach. Further discussion regarding the 2027 scenarios will be later in this presentation. 2028 is not adjusted and reflects prior analysis to demonstrate the need for continued fiscal stewardship and planning. So we acknowledge that this is below our 15% that we have in our policy, but this we left at our original forecasted amount as we start making changes and decisions as we go through the 2027 budget process. Questions on this? Right.
And I think this, if I can, this just shows again that challenge with the staffing and the structural issues where we are really planning on in 6-month increments, and it's really hard to do when you're trying to retain amazing staff and you want to support your staff and just with the way that the funding landscape is right now for public health, and as you all know, with just the general our funding sources right now, even with property taxes, we're in a change and it's uncertain. And so we're doing our best to make as much certainty as we can out of a very uncertain time.
I also want to say, I mean, this slide is what the board has been focused on quite a bit since we went through the priority-based budgeting. And we did have to make a lot of really hard cuts. Like the last year and a half was very, very difficult. And yet we are not there yet, right? So the board spends a lot of time talking about how do we get into financial sustainability so that we are not dipping into our reserve, because the reserve funds we have no way to backfill those funds. I mean, what we, we're talking about the grants, those funds are all accountable to down to the dollar, and whatever is not spent, we have to return. So there are so few opportunities for us to bring new money into our reserve funds that we cannot continue to dip into it the way that we are needing to for the next several years, and that we have been for years and years and years. So this is something that the board is really focused on too, is we passed a policy saying that we would not go below 15%. We are projected to go just below 15% in the next couple of years. So that's, we spent a lot of time with the management team talking about how are we going to stay within the policy and further bring the organization into financial sustainability, even though we've already done so much to get closer to that. In the last year and a half, we're still not there.
I wondered if, and it might not be, that it's not necessarily specific to this slide, just in this section of the conversation. It'd be helpful to me to hear an update in regards to the ARPA funding in one of the, or in the packet, maybe it was talked about as part of that county transfer. Just but to understand where you all are with ARPA fund spend positions, term.
Sure, we can give you that information. I can tell you off the top of my head that the Family Connect's ARPA funds are fully extended and
Yeah, we have
no longer.
we only have 10 years. Yeah, we have some FDH funds, so it's not much. Yeah,
like a couple 100,000.
yeah, sorry. Okay. But we can get you the details.
And that was one of the ones that we assumed would be gone in 2027 when I started doing scenario projections, is that was a row that I zeroed out.
Thank you, Mrs. Jim.
Oh, great, okay. All right, then, we're gonna talk a little bit about the work that we've been doing on fiscal stewardship improvements. Next slide, yeah, I just want to brag on the team a little bit. This was last year, and Armando was amazing, but it really took the village on this one to not just to figure out what we do and how we do it and what we had to achieve, but we really tried to use a very participatory process as much as we could with staff, recognizing that this is a very awkward conversation to have with staff. And the outcome was heartbreaking and also magnificent. And that's, we find ourselves in that space a lot these days. The team was, recognized really broadly by local, state, and national groups. We're very proud of them and the work that they did, even though it was the worst kind of work you should have to do. The time that they put into it, but also the care that they took with the staff about how decisions were being made. So I just really, y'all are great. And this is a continuing process that we will use every year. We'll continue to improve it. And thank you for leading it, Armando, and go get them.
I want to do one call out here if I may, but we got the budget book award for the first year due to Sarah's intense dedication to getting us back on track. And so we're continuing to make some improvements for next year so those get scored and you get feedback. So we're working on some of the feedback we got. Where Sarah is being very diligent about getting that feedback. So we can make it better next year. So.
I think you asked, I can't remember who asked about the lessons learned.
We're going to talk about that in just a second.
Okay. Because I was going to talk about the role of the division managers.
Yeah.
And that's important.
Go ahead.
Just before you leave this slide and get into that, just like as a local government nerd, self-proclaimed, like having the GFOA award is really important and not just symbolic. Like it is a recognition of the effort and the professionalism and the credibility of the work that you've done. And so it was so exciting when I heard you guys got the GFOA award. And so that I hope brings you all much joy. It just is really, it's a cool logo, but it's really a cool recognition of your hard effort and that you've met the professional standards that we need to see from our local governments, and you've done it. So that is like the grooviest thing. Way to go.
I would also just add, yes.
The other thing, and we'll probably talk about this in best practices, but this is the moment where the board and the team really connected because we all had to do this hard work together. And I want to shout out to Brooke Harrison, who is no longer on the board, but really took the mantle on this issue for the board and along with others and really drove it in terms of the board leadership position too. So it was really, it was a pretty cool moment, I think, for us as a team. And it was hard, but I think it also showed that we had the resiliency to get through that together in a way that was really effective. So it's like our shining moment for the year. And I think we're all really proud of it. And yes, it was hard, all in the same breath.
I will also mention a few of the supportive processes and policies that we adopted in response to the priority-based budgeting work. We developed a new grant intake process that basically combined about 4 processes that were separated into one process and clarified approvals, roles and responsibilities, documentation, consistency, just time turnaround much faster. It was very effective, and there are a lot of people to thank, but I'm going to do a little call out to Patrick for that one. He is our guru in those kind of processes. He's done a great job. We are also tracking vacancy savings very carefully. That is something that Desiree, I think, and Sarah have really implemented, and that was very helpful when it came to the budget amendment that we needed to consider to know exactly how much we had in vacancy savings. We developed a fiscal hierarchy policy when we saw the federal government last year pulling grants back. And the policy says that to the extent that it is aligned with time and effort, we will spend grant funds first and keep our flexible funds till the very end as much as possible. There's kind of 3 gradations. There's restricted funding, there's semi-flexible funding, like for instance, the B1A tax money. We can put different kinds of positions on it, but they're related. They have to be related to, community, maternal and child health kind of stuff. So that's semi-flexible. And then we've got, a small amount of flexible funds. So by spending it that way, it helps us to kind of retain those reserves as much as we can. And then the revenue recognition procedure that we mentioned earlier, that we don't recognize funds until we get the notice of. Next slide. It's me too. All right. Priority-based budgeting, you all know that what we've really been focused on is creating an intentional, more data-driven and transparent allocation process according to, it says agency priorities. What it's really about is community priorities. The scoring card, and I hear y'all have your own scoring card at the county. It incorporates really a focus on kind of what is the community data showing as a need. And it really allows us to kind of update it every year, not just in terms of data, but also in terms of what are the criteria that we're using to kind of figure out what our priorities are. I will say that last year, what we mainly used the outcome of the priority-based budgeting process, because we feel like there are still some improvements we want to make to the scoring process, was we really used it to identify what are our high priority initiatives that we really want to make sure continue. We did not use it to cut staff. We used it really as a way to say, okay, this is where our focus needs to be when we have resources. And that was actually very helpful. We still knew we had to make reductions, but we were quite in a place where the process could give us enough information around that. So a couple of the things that we're doing this year, we're going to look at the 2025 baseline metrics for our agency performance system so that we can actually start collecting a little bit more of that information on what our programs actually able to output. And we're also going to talk about, so priority-based budgeting is, what it does is it compares programs to programs. What it doesn't do is tell you how much staffing you need in a particular program. And so you could come out with a priority-based budgeting process where one of your mandated programs has half the staff that they need to really function effectively, and another one has 100% of the staff. So we want to start paying a little bit more attention to that kind of workload balance across the agency. So we're developing this concept of meaningful minimums to achieve the mandates, which really has to do with kind of state expectations, productivity, et cetera, so that we can kind of fine tune some of those decisions a bit. And I think you all saw in the workforce section of the pre-read that one of the things that we've learned over the past couple of years is that we've really had an imbalance between our infrastructure staffing and our programmatic staffing. And it's not about, you know, how many people do we want doing this job? It's really about the agency's ability to be effective in the community if it doesn't have enough infrastructure. And so we've been kind of slowly paying attention to that and working towards that too. And that's been really important. I think it's been really effective for us to be able to manage the workloads, but also to kind of improve the work that we're doing.
I will also say the scorecard piece, I think was helpful as a start for the conversation, but it is something that I think caused the staff a lot of anxiety also.
Yep.
So, you know, because nobody wants to see their program with a lower number than some other program. So that required a lot of communication. And I still think we probably should have communicated more about what the matrix was being, or the scorecard, how it was being used.
Yeah.
Because it caused a lot of anxiety among staff.
That might be a lesson for the counties.
Yeah.
Right, but we didn't include infrastructure because we was very low, because we don't interact with the community, right?
Yeah,
So
and
they're-
that's really the.
And somehow our mother still had to.
Community impact that other programs who are delivering services out in the community are having.
Do you want me to share now?
Go ahead. Yeah. So one of the things that was the most productive, I think, for this conversation was actually not the director's team. It was actually our division managers. Armando had put together what was it? Scenarios, 3 scenarios.
Yeah.
And then we as director team said, okay, let's pick one scenario we're going to move towards. But the division managers are the real individuals that really took a look and took it to heart and had to make the hard decisions about what they needed to prioritize. So I could not, as a deputy director, be able to articulate what should be cut, what should we do differently. You really need the people who are the subject matter experts or the supervisors that understand the work to figure out where to make the most effective cuts. And so I do encourage, when you go through this process, that it is not director level decision making. It is more of your middle management that is really going to contribute to recommendations to be successful. Anything to add? It was hard.
It was hard, but that made a huge difference. Because the staff in the divisions had buy-in to the recommendations that they provided. They were hard recommendations. You know, they were sad at some times, but I think that folks really, they understood why they were making them. It was always tied back to the agency as a whole, which was another important piece. We really, you know, strive not to just think about our divisions individually, but how it supported the agency. And I would just add one other thing. PBB became a swear word, like a naughty word, right? And so I think we have this year really tried to reinforce to people that this is a budgeting process. This is not every time you do PPP, you're going to be cutting millions of dollars out of your budget. That was a restructure, reorganization, but PPP is a method that does allow you to make really well-informed decisions. I think that has been helpful this year. Thank you.
Hey, any questions before we move on? Okay.
So as we start to build the 2027 budget, we are very cognizant of some of the fiscal restraints. And so I'm going to walk you through some of the things that we're watching from a federal level and state level. So as I think we are all aware, the federal budget is largely funded. September 30th, there's always some hand wringing and some decision making that's still happening. The administration's proposed 2027 budget does reflect many of the reductions that the same administration proposed for 2026, but were not taken when it comes to public health. So the slide, as you see, shows about a 13% reduction to health and human services. This is a cut of about $4.3 billion. So very much watching that. We're also very concerned about the disproportionate impacts on equity-focused populations and vulnerable populations. And again, the continued areas of concerns, as you know, we saw significant reductions in immunization funding. We're seeing changes in Medicaid. WIC, we believe it'll be okay, but there's always some conversations. That one we're also watching. Obviously, climate change and environmental justice, LGBTQ plus, and DEI work. The other one that is very concerning for us is the indirect cost. So I believe last year the administration capped indirect cost for educational institutions, and I want to say also hospitals and some other healthcare entities at 15%. Our indirect cost rate that we've negotiated with the state is just shy of 24%. And so if we do see this cut, that will be a significant impact. And where that impact will occur is on your infrastructure programs, because the administration and finance team, as well as the strategic initiatives team, is largely funded with the indirect costs that we receive through grant funding. And so that would be very difficult for us to manage. Next slide, please. On the state side, noticing one thing I did not put on here will be in 2027 is we'll have a new governor, as well as a new team. And so that raises new questions.
CDPHE director.
New CDPHE, new healthcare policy and financing, new human services, new early childhood are the 4 key agencies that we work with. Stepping back, the governor did sign the 2026 budget that begins July 1 on May 8th. There is a cut in there to local public health funding. This is also called the per capita funding. Overall, statewide, that was a reduction of about $1.5 million. We're waiting for our final numbers. We've seen some preliminary numbers, but I'm waiting to see what the final reduction is for us. So we're definitely budgeting that. That will affect us in 2027 because we'll use the first half for the last 6 months of this year and then kind of push that cut out. As Lexi and the rest of the team have mentioned, we are not seeing our federal funds that are passed through the state moving as quickly as we had prior to this administration. And so we do see some delays there. There are ongoing regulatory changes. I think Commissioner Stoltzman, you had asked about this coming through. I think we're waiting for a lot of the rules and regs to come through based on what's being signed here in the next couple of weeks or has been signed from the governor's office. And then that continued discussion of unfunded and underfunded mandated work that I know Lexi and her counterparts have been talking about. How do we really put our arms around that and how do we make that argument? Because that's continuing to put capacity strain on staff. So I'll continue to talk about local constraints.
We are acutely aware of the county's own budget reductions. We also have some curiosities about what the rent change might be in the new building. We understand the rate per square foot will likely be higher, but we also recognize it's a much smaller footprint. So just kind of curious around that one. We continue to have some spaces of unfunded or underfunded mandated work, which we use our precious flexible funding for that seems to be getting kind of a little bit tighter and tighter. So I think that might be a conversation that we want to have with the Board of Health and the Board of County Commissioners about how do we manage that going forward. And then we are also seeing a shift in focus of philanthropic donors that really has to do with kind of the broader healthcare landscape and social services landscape where they feel they need to address immediate issues in the community, which we understand. They feel they need to, whether you agree with this or not, supplement the Medicare cuts, the Medicaid cuts that have happened. So we're just seeing a lot more competition. I'll give you an example, the TGYS, the Tony Gramsci's grant that we've gotten for years. This year they had applications requesting $50 million for $10 million in money. So that's the kind of competition that we're seeing in the community. We've never seen that before. So we're just seeing a lot more community organizations like turning over every stone, which is great. And it has an impact on us. So, yeah.
Excuse me, Lexi. Thank you. Someone read my mind. And you might be going into this, but I think what would be interesting for me to understand is at what point in a timeline in the budget process would you all have numbers to be able to discuss for us to understand? I see kind of a list of what it might be entailed, but and if you don't know that yet, that's okay.
Yeah, that's actually something that we were hoping to discuss at the end of the meeting. If there might be another chance to get in front of you all and we have a little bit more documentation of what we're looking at.
Thank you.
Okay, and then the next slide, just to talk a little bit about the county funding, the general fund. We all know it was reduced from about 8.6 in 2023 to 7 million. That stayed flat in 24, 25, and 26. We calculated that initial drop was equivalent to about 10 positions. Because it's flat, we have been absorbing all of the COLA and merit increases since 2024, which is equivalent to another 10 positions. Assuming it's flat in 2027, that would be another 2 to 3 positions that we would either have to find other funding for or find another solution for. The other thing we wanted to mention was that we completely support the county's adoption of the bilingual pay. And that is an additional burden because it is, I mean, obviously for the agency's general budget, but we don't get, I mean, we're having to pay for our county funded staff that are in those positions. And we have met with some surprising resistance from some of our donors who don't want to pay that, which I'm kind of surprised about. But maybe there are some different ways that we can recognize that additional salary cost that would be more amenable to them or something like that. But we would like to discuss if it's appropriate, this continued deficit that we've seen from having the flat funding. And we don't have to do that right now. We're going to move to the next section.
Yep.
Unless y'all want to talk.
So I think what would be helpful for an input for our conversation would like this quantification of the amount that you're talking about is really helpful for our conversation. I don't know, Jen, if you want to talk about the rent right now or if that's a later conversation, but I think just quantifying the dollar amounts that you're talking about for each one of these. So as we're looking at our priorities, we can consider that.
Thank you.
Yeah, so add on to that. Were you finished? No, I was gonna try to turn it over to both of you, so that's perfect.
Okay. For me, I'm looking at Janet, a question around the union and how that can fit into this conversation based on what's on the slide, just caught my attention. So however that needs to happen, I think.
So we actually made a decision not to offer employee bonus hours this year, which is, and we don't offer spot bonuses this year because we can't financially afford it. So we did meet with Carl from the union to say, is this going to be a union problem for us because other departments are offering it, but we're not offering it? And he said, in the language, it says may. So we have chosen not to offer our staff spot bonuses or employee bonus hours, which is paid recognition time off, because we're in this financial situation. And the union, Carl has said it's okay for us to continue. Is it good for morale? No. Is it have a bad look? Yes. But is it potentially someone's job? Yes. So we are doing everything we can to keep everything tight so we can keep as many people employed as possible. So that union engagement has started happening and Carl's been great.
Lexi, one other thing that maybe you and Jenna have already exchanged this, but one thing in the rent setting that has come up in the past is just some of the, with so many of the people in the new space on grants, like some of the grants cover space allocations and some of the grants don't. And so like when we've looked at this in the past and worked through this in the past, like we don't want to change rent rates in a way that third-party funding that was covering rent isn't, and then it shifts it into discretionary funding covering rent. So just when you're putting that together, if you haven't already, that's an important concept.
Yeah, I want to speak to the grants a little bit and represent those who are on grant funding. Our grant funding has remained flat for many years. And because of that, every time there's a COLA and merit increase, we have to use that grant funding to meet. So anything like adding rent into a grant is really not in the realm of possibilities for many grants because we are just basically getting by covering everyone's COLA and merit. So we can look at it. I just want to be honest, though, that I remember in the past us paying rent on our FEP grant or our CRI grant. But because we haven't been able to get those increases in the grant revenue and they've been flat, we're absorbing more and more of the personnel costs associated with it. So these operating costs are becoming fewer and fewer.
And maybe it's not relevant for public health grants in particular, but some of the reimbursement rates from the state and things like that have different categories that you can't use it for anything but rent. And like, so it just depends. So that's all I'm saying. It's like
Maybe in the indirect or
I think correct.
It's a place to explore.
I think it's something that we don't want to make a broad decision on an allocation if that ends up eliminating revenue that is coming in. Like, and Claire talks about this a lot. It's like, are we actually saving anything or not? Like, if we're just decreasing the amount of revenue we get by doing this, it doesn't actually end up helping.
Right.
It's helpful to have and see what that might translate to, just, so that it's not just in principle, we should or shouldn't do this, what are we biting off? And I think I'm gonna, that general fund transfer, it's been a couple of years now since I really looked, and your budget has changed and you've put it together in a very, very different way. Is that 7 million, that's unrestricted funding, correct?
It is.
Yeah.
What it covers basically is, and actually we go into this a little bit later, so maybe I'll mostly punt this question.
Yeah.
But we show you what it covers. It was also in the pre-read, kind of what the county funding goes to. It mostly goes to our middle management and upper management positions because we don't have funding sources for those. The other thing that it funds is several positions that the county actually receives fees or other revenues for that from other departments that are passed through to the county and mixed with the general funds and then comes to us for the work that we're doing for those departments.
Well,
So like
Plastic inspections.
septic. No, not septic, not, no.
Oil and gas.
Yeah, it's oil, it's in here. It's oil and gas. We do food plan reviews for CPP. No,
We review all of the building permits for.
we review, thank you. We will review the building impacts. Okay, so we haven't documented the several positions. Yeah.
Okay.
Yes.
Okay. So this is going to be a 2027 budget development and scenario review. So this is just a little sneak peek into kind of how we start setting things up. Next slide, please. So here is our policy that we were referencing. This is the funding priority policy. So this is how we allocate personnel and operating costs to grants and other funding sources. We found that this reduces administrative burden, minimizes accounting errors, and ensures optimal use of both our restricted and flexible funding streams. And you can see here we have the funnel showing the restricted grant and funding sources, scope of work, and then the term, and then the last funding that we'll be spending will be our flexible spends.
our flexible funds. So the funding for restricted must be used in accordance with a defined scope of work, funding terms, specific deliverable for FTE. And the flexible funding sources such as reserves or unrestricted local dollars can be allocated more broadly. And Lexi mentioned some of the funding sources earlier, and sometimes they do have specific uses and sometimes they're more broad. And so we generally only use reserve as a stopgap measure at the very end. We have used it in this past cycle to extend those term positions while we waited for the federal monies to come in. So these are the decisions that we kind of make on the daily as we have shifting revenues and new information that comes in about programming and how people are going to be covered by their grant funds.
So on the next slide, we'll walk through the high level 2027 budget scenarios. As was alluded to earlier, we had 3 scenarios when we were developing 2026, and we followed that same methodology as we start to look at 2027. So scenario 1 reduces our reserve draw by $300,000. It also shows the reductions to the per capita funding or that local public health funding that we get from Colorado Department of Public Health and Environment. It also zeroed out the ARPA funding because we expect that funding to be fully spent by December 31st. So what you see there is a reduction of $710,000. The middle column, basically we ran this scenario 2 different ways for each one of the larger scenarios was based on the adopted budget. So based on the $20.6 million, which the board adopted in December. And then we reran the scenario again based on the budget amendment. And that was the $22.3 million. So scenario 1, we're looking at a budget between $19.9 million and $21.6 million. Scenario 2 includes scenario 1, but it also assumed another 20% reduction in federal grant funding based on the budget proposal put forth by the current administration. So there it would be an overall reduction of just shy of 1.1 million for a budget of between 19.6 and 21.2 million, depending on where you start that base. The final scenario, scenario 3, includes scenario 1 and scenario 2, but it also includes a 10% reduction in the county transfer based on the discussions that you all had last fall. We felt it was prudent to put that in there to look at that. We know that you're going through your discussions and your priority-based budgeting process, but again, we didn't want to lose sight of the conversation that you had last fall about that reduction. So if that were to play out in addition to scenarios 1 and 2, we would be looking at a reduction of $1.7 million or a budget between 18.8 or $20.5 million. Initially, we had looked at projections for 2027 at 20.9. So that scenario 2 feels realistic. It feels appropriate to where we're starting. As I mentioned this morning, we met with our program to start the 2027 conversation looking at revenue. And so over actually next week, we'll be having budget study sessions with all of our divisions to start to build that revenue number based on the information that we have available today, but also looking at their operating expenses. And I think that's all we had for budget and finance.
Any questions on budget and finance?
Not yet. What makes you guys so awesome? Any questions? I think you've done a great job. I think you've done great. Thank you.
Okay, great. Our final conversation of the day is we want to give you a little bit of a preview of some of the data that is emerging from our agency performance system. This has been a while in the making. It was a pretty complex process because we have a team that really does exceptional work. And sometimes that takes a while. This kind of a process always takes a while, though. The other thing that's really interesting is that we built it completely from scratch. We didn't have anything in the agency like this prior. So that team has done a remarkable job of really creating something from nothing. And we're excited to kind of share with you kind of what the framework is and also some of the early data.
Go ahead, Patrick. I know if under other circumstances, I would definitely stand up and stretch because you've been sitting for quite a while, but you just take a deep breath because we are changing years here a bit. You will see in front of you also, you have a couple of very large pieces of paper for us, people who are wise in years and have visually impaired somewhat. So that can be helpful because I know that the slides that I'm going to be showing might be difficult to read on the screen. So these big ones under there, yeah, these big ones. Even I can read these. And so again, my name is Kelly Hinch. I use she, her pronouns. And this month is my 8th year with Public Health in Boulder County. And I am currently the Strategic Initiatives Director. So for the next 2 slides anyway, I am going to give you a very brief overview of, as Lexi was saying, a comprehensive our agency performance system. And agency performance system, as we're defining it in this space for y'all, is how we track and evaluate our agency's overarching work, not just a program specific work, how we track and evaluate our agency's impact of the community, or as Indira mentioned earlier, maybe some target populations, disproportionately impacted populations, et cetera, and how we collect critical data and information that allows us to make informed decisions around agency strategies, programming direction, and financial decisions that enhance our efforts to create a healthier Boulder County. So that's what we mean when we talk about the agency performance system. So in this presentation, I'm going to give you a brief, but I think important, just context or background of how we got here, walk you through this graphic in front of you, have a second slide that highlights some of the data, and I'll give you a little bit of a synopsis of what's to come. So the first thing I'll try to do for y'all, when I came here 8 years ago, we had operational plans and programs provided data individually. There was no sort of way that we looked at it, a systematic approach to how we're collecting data. How do we bring notes? See that there, Patrick, great, that's okay. And so we started to think about how do we roll up this data to look at what we're doing as an agency. And that conversations were started in 2019. And lo and behold, COVID happened. And so all our team was thrown off for 2 or 3 years into different work and things like that. And when Lexi became director, and Indira and the management team that we have now, we've really sort of looked at how do we build an agency performance system that allows us to communicate the impact we have at the community, the work that we do. And we also heard from y'all, to be honest with you. In 24, 25, I remember the Board of Health and the Board of County Commissioners both asking us these particular questions. And since then, we've been moving that process forward. And as Lexi said, building it from scratch. And a lot of this involves for cultural change. So again, this has been sort of a shift in the way that as an agency, we collected and used data. And there's still ways to go, but we're on our way. So if you look at this framework, again, look at the bigger documents if you want. It's easier to find that way. But as you can see, what we're looking at here, I'm going to walk through the big sections, and I'm just going to go through each particular one in a little bit more detail. But we're looking at what are our public health priorities, what are we doing, how are we doing that, how well are we doing, what's the impact of that, and how does that go back and influence our priorities. And then there's a section to the right there that talks about data modernization, right? So in the first section, the top section, that really talks about, this is what are our public health priorities. And that really talks about community needs, right? It's understanding what dictates what are our priorities as an agency. So that's captured through our community health assessment. It's captured through needs identified by community partners, by the work that our programs do. It's that sort of need. It also looks at population health data. So we need to look at what is population health data telling us. And equally important, but a bit more difficult, is what are subsets of population that may be disproportionately impacted, and what does that mean? I'll provide a couple of examples of that a little bit later on. So it's looking at that population health data, whether it be the large population of Boulder County or subsets of data. It also looks at public health requirements, such as what's outlined in the Colorado Core Public Health Services that we're supposed to be doing and other federal and state regulations. And again, responding to deeper disparities that drive priorities, right? So we're looking at what are our priorities in that particular space, right? If you go down to the next column, what we took those priorities and we're looking at identifying.
I'm so sorry to interrupt, but is everything okay over there? I just don't know what happened.
It says it's a person who doesn't have a Teams identity, so I can't see who it
Interesting.
is, yeah.
It's gone. I'm sorry for interrupting. I just wanted to make sure everything was okay.
I'm sure they'd be interested in listening.
Yes, yeah.
So,
Great. That's a good attitude. Good.
I mean, I could boot them out, but it could be a member of the public who just has their camera
Great.
on. Sure.
let them roll.
It's not one of us, right?
Oh, that's not good idea.
Yeah. They heard us talking about it.
Yeah, so I think one of the most important things is that we were trying to find a framework that captures all the work that we do, right? We could have built something that's built around our health divisions, different spaces, but after a lot of back and forth with management team, with Lexi, with our Board of Health Strategic Planning Committee and things, we came up really with a framework. And that's sort of what you see in sort of the middle spot where we've identified 6 priority work or core work areas. And as you can see, those include mental behavioral health, maternal, child, and family health, emergency preparedness and response, recovery, infectious disease prevention and control, environmental public health, and good governance. And all our programs fit within those 6 particular work areas. And so that allows us to collect data that rolls up to 6 particular work areas that helps in those work areas, help us define or work through our priorities that we're looking with the community, or help us define what we can work within those priorities. Underneath that, you'll see we also have our strategic priorities from our strategic plan, which you all have seen before in the past. And what those spaces are areas of work that we want to dive into more deeply and commit more dedicated resources. And these work areas, as you can see underneath, are mental and behavioral health, which aligns directly with one of our work areas, also aligns directly with one of the county priorities. Emergency preparedness, response, and recovery, climate action. Those 3 are all external facing strategic priorities. And then 3 internal facing priorities, which include health and racial equity, community engagement, sustainability, transparency, and stewardship. And so we have indicators for our strategic plan, but they're embedded in part of the larger core work areas that we're collecting data for and rolling those up, right? So if you go down one more section is like, how are we doing the work? How are we doing the work? And that really focuses on the division managers, Indira and others have pulled together. We've been working with them on pulling together what are operational work plans, right? And so what with those work plans is that they are defining what their work plans are for the year, and they're connecting them back to both downward to some of the KPIs, which I'll get to, right? And connecting upward to those same work areas and also to the priorities. So that's how we're trying to do this work and how we're trying to collect that data, if that makes sense for you. Again, operational plans, I think, are heavily informed by the key data that we are expecting the individual programs to collect. And they roll up into the work areas. So there's a process of doing that. And it also allows programs to make better data decisions, data-driven decisions, right? So if we get the right KPIs, select the right data, it allows us to make the best choices in a way we can maximize the limited resources we've been talking about to make better impact on our community. So, and the next level down is how well we're doing. And again, in order to evaluate how we were doing, our agency identified some KPIs. And strategic priority indicators that I mentioned earlier. This is the data we want to collect in order to understand our community impact and where we would need to work more or go next, et cetera. So to date, we have collected key data. Frankly, it's kind of really deep baseline data from 2025. We're using that to roll up into different spaces. And right now, we are looking at, there are spaces where we can look at some impact. There are spaces, but it's more spaces where we can find some outcomes. And we certainly have a lot of spaces where we're looking at reach. And so that's where we're at right now with that particular space. But going forward for the rest of the year, we're trying to work with programs that they're able to identify what is the what continues. They collect this data. Is it the right data we want to collect? How do we clean up that data? How do we understand? How do you move that data to real KPIs, right? How do you move that data that we set a target with it? And then we can compare it year to year. How do we use that data to look at outcomes and eventually impact data, especially in particular as we compare it to potentially in population health data, whether it be broader population health data again, or subset of that population health data. So that's where we're moving toward in this space. And our goal at the end of this year is to be able to have a really good set of KPIs for our entire agency across all our programs, and be able then to collect data from 2026 and early 27 and start being able to build this foundation of process of data that we have to work with. And again, we're working closely with all the program teams, management team, and particularly the Board of Health Committee, Strategic Planning Committee, which has been extremely helpful. Both Amber and Stephen have been great in providing some expertise in that particular space. And then lastly, if you look down again, the community impact piece, this is not lastly because there's one on the side, but if you go down to community impact piece, again, that's where we're trying to use those KPIs. But if we look at impact, that has to come around to lessons learned about what are our priorities going into the future. What have things shifted? We don't know that, right? Things shift all the time. And so we understand that this is a system that needs to be dynamic, doesn't need to be static. We need to be able to continuously review it. We need to continuously collect data that will be able to help us make the right decisions in this space. And on the right, you see data modernization. And on the data modernization piece, this is, I think, one of the population health epidemiologist on my team described it, I thought, the best. It's the plumbing, right, of this whole system. And it is how we build internal databases and systems, how they talk with each other. How do we make sure that these systems are able to draw data? For example, yesterday was back and forth with Lexi about, hey, you have this data, we need this data or whatever. We want to build a system. Anybody, including you all, can be able to tap into that system and be able to collect data that you want, that from our programs and from the community. And we are working closely with county IT team. We're working closely with Stephanie Kinney's team in this space as well a bit, in order to look at how we can work with each other and how to maximize this space, right? Because it's a pretty good lift as well. So that's a space that's going to take time. All these spaces take a lot of time, and again, it's culture management. So we are collecting all the databases that this agency has, which is a lot, and trying to figure out, then we have to build mechanics behind that on how they are all connected. And we may be working with some partners on that, including potentially the CDC and others with that space. Okay, Patrick, you can go to the next one. This slide, I didn't want to pull too much from the slide because you've seen it. It was in the pre-read. It's also in our the draft annual report. And so I'm not going to go through each one of these data points or anything, but a lot of these are the reach data, some key reach data that we've, that are from 2025, right? And again, we're trying to refine some of these, but there's just a lot of data. We have like 125 KPIs at this point. And as Joel was saying yesterday, the net is cast wide with the idea of eventually pulling back and how the number of indicators, the number of KPIs that we have. But right now, we're just trying to build that system and pull some things back. But I won't dive into necessarily any one of these, but these include the 6 work areas and some key, very confident data that we have from each one of these work areas, right? And I think there's additional information that was in your packet, and we can certainly provide additional information for you all. But we also use this data. Data can be used in so many different ways. I'll give you an example with our Genesis program, right? So with the Genesis program, I'm going to read this because I want to make sure we'll get mad by the Genesis colleagues. It's a home visitation program that supports healthy parenting practices with teen parent families in Boulder County, and up to like the child's 3rd birthday. And so if you looked at Genesis and you looked at data, for example, as percentage of reach or percentage of people that we reach, if you looked at the entire population that had been pregnant, it's really small. It's like 2%. But that program focuses on pregnant teens. And for that population, we are reaching over 80%. And we know from data as well that the outcomes, like low birth weight outcomes, are much better in the teens that we reach than folks who we don't reach with that program. And so that's sort of the way, these sort of ways that we can look at data and be able to tell a story. You all talked about earlier was Lindy or somebody was talking about how do we tell that, Morgan, how do we tell that story? That's a whole nother piece with this, how, our communications team is embedded really deeply into this work, right, as well. How are we trying to do this? How are we trying to tell that story? And that being deeply embedded is critically important for us to be able to tell that story and how we work with that data. I think Claire.
Yeah, just a question. I mean, this is really great. And these numbers I went back to your vision and your mission and your vision, and that's very broad and it's very beautiful. But this really tells what you're doing, and it's very concrete. But it's the outcome, that you were referring to of if you're reaching 80% of teen parents, what are the outcomes over the long term? Are you working on figuring out how to capture that?
Yes, absolutely.
Yeah.
That's, I think what we're trying to do again now for the remainder of this year is looking at cleaning up. I don't want to use the word clean up, but figure out, are we collecting the right data, right? Even for some of the reach spaces. And then we're thinking about how do we build KPIs that have targets, and how do we eventually move some of the reach work into outcomes? And then eventually, how do we work into comparing that to the population health data, or how can we attribute to some of that? So it's a longer process. I think some programs, I know like there are some programs, I won't say who they are, right, are really good data and can produce some really good outcome data. There are some programs we have that we think they can produce that, but they're really not producing it. Again, this is a culture shift of what they've done in the past. So yes, we're moving toward that, but I still feel we are a bit away from arriving where we want to be. And frankly, I don't think we'll ever.
I know. I mean, this is a really good representation of what you do. You have this many inspections, you have this many, touch points with, blah, blah, blah. This is what you're doing. And the outcomes are, why, what matters. But I think for some of those, you may never actually be able to point to the data. It may just be research based, so that we know when teams do this, that this happens. because it's-
Yeah, it's evidence-based.
20 years. And, you would need to do longitudinal studies, which are, very sophisticated studies, but at least you can have that kind of, the research tells us that if we do this thing, then this will happen.
Yeah, like a good example is like our works program that provides genome exchange or storage exchange.
Yeah.
One of the outcomes we look at is HIV rates. And we have some of the lowest HIV rates in the state. And when you look at, say, not to compare, but when you look at Will County, our HIV rates are considerably above.
I think you're comparing.
Yeah. But my point is, they don't have an active syringe program.
Yeah.
And when you have one versus when you don't have one, you're able to look at those types of outcomes.
Yeah, for sure. One of the things, a couple of things. One of the things that I like about this is when we're able to articulate how much of the population that's affected by this we are able to reach, then it gives us a much clearer indicator of how we're affecting the outcomes for that population. So for instance, our works program reaches something like 93% of the population using drugs in Boulder County. And so that's a very close
Of all the syringe.
Yeah. So it's those kinds of, so that's the work in front of us for the next 6 months is really to, okay, we've got a bunch of numbers. What does it mean? How do we interpret it? And I do want to reinforce that this is just an example, just to give you all a little taste, a little amuse-bouche before, as we're kind of validating the data, as we're interpreting it. We do have a lot of outcome data. I think our maternal and child health programs in particular have a lot of outcome data. I know that our HEAL program has a lot of outcome data that Rachel will talk about in a second. But this is just a little taste of where we're going.
And I'll wrap this up really quick also, is I think the other space we really want to work on is looking at populations that we know are disproportionately impacted, or have health disparities that, again, the impact is greater than the general community, right? And whether that be the Hispanic, Latinx, LGBTQ+, mountain communities, there's a number of ways we look at, and trying to get subset data on that, which is difficult, but trying to get that and figure out how we work with that, I think is critically important, because it's often those populations that may drive health outcomes in a community. So, we want to make sure that we are able to target better or the best we can before we can make the most difference. So
there's one other thing I'd like to mention about this framework that I really like, which is we collect data at the program level, but what you're seeing in terms of these 6 categories, there may be a program that contributes to 3 of the categories. So what it does is it really allows us to aggregate the work in that category, even if it's spread across the agency. And so historically, we've really focused on the divisional structures, but the divisional structures didn't tell us the story of our impact, because one program, even though it's situated in one division, it may have impacts across a bunch of different areas. And by collecting those impacts in similar areas together, it allows us, as Kelly says, to roll it up and to kind of figure out an aggregate indicator for that work across the entire agency. All right, I'm ready to move forward. We're getting close on time.
we got to keep moving.
Okay. This was just a fun little project. It was put together pretty quickly, but I was thinking about Ashley's request to understand better the bang for the buck. And, it's a little tricky because most of the county funding really goes to supporting management, because that, we don't have funding for that. The supervisors, the division managers, the leadership, all, those groups. But what I wanted to do was to kind of take a stab at it a little bit, recognizing that there are some other positions that are funded by county. and just kind of see what would that look like if we tried to start doing something like that. So I categorized it according to the county's priorities, balanced budget to resources. So we have 3 staff who are funded by county general funds in the budget sustainability and stewardship category. And you see, I don't have any numbers there because this was really a mental exercise for me. And then accountability in terms of planning and evaluation. We have 2 staffs that are funded there, and they delivered 125. This is for the team, right? It's not for those individual staff, but that team delivered 125 baseline KPIs. They supported the staff operational plans linked to the KPIs, and also did quite a bit of grant planning. So the next couple of slides just kind of go through that kind of an analysis. Of course, we'll send you all the slides afterwards so that you have it. But I just kind of wanted to experiment and see, is this helpful? Is it not helpful? Would you rather just see kind of what the whole agency results are, or are you interested in seeing kind of where the county funding is going in terms of programmatic work?
I'm open to seeing both of them. And I think I'm also considering that the Board of Health is sitting here. If you all are going to make those decisions, I mean, even if we were to say with the budget, here's what we think the money should go to, really the Board of Health is making those decisions, and you could shift that to staffing. That's my perspective, but I think it's helpful to just see and understand.
Great. Well, this can be an evolutionary conversation. I was just trying to play with that idea.
I think it's incredibly useful to see personally. But if it's only useful for me, then it's really not useful. I think these tools are useful for improving the conversations, like even looking at this, the slide Kelly was showing us, the big paper slide with everything in that. I think that allows us to then have really interesting conversations with each other and say, like, is this where we want to focus? Is this how we want to do it? So for me, this is really useful, but only as useful as it brings the conversation forward. And then we talk about, you said something very inspirational at the beginning, but that is what it is all about. It was like, how do we be a government on the side of the people? That was the Lexi quote from early on in the thing. It's like, what does that mean? And how did we deliver? So I think this could really help us.
Great.
I think this also sets us up for, sorry, Claire. Yeah.
What you're trying to do here, but would we want to see it this way, or what was the other way?
Or just the whole agency performance system results.
Well, I think to that ask for, help you fund COLA and bilingual pay and stuff, I think it is helpful to know, what we're funding. And if it really is like one FTE in air quality that is county general fund, if that's how it actually works. I think you provided us with a spreadsheet of which a couple of years ago.
I think I could provide you with the staff that was on county funds, but what I couldn't provide you with was the bang for the buck they're doing.
The reach data that.
So it's had like that column on the right.
Yeah.
We have the first 2 columns.
But yeah, I think, this is where we're trying to go, is
Right.
linking the work of the teams and the impact they're having. And
Yeah.
so then when we get into these hard conversations, it's like, are these the right priorities? Which I think you'll see most of these are like really core public health.
Yeah.
You wouldn't argue about most of these, but then if we are making tough decisions, there's more situational awareness. When we start to talk about staffing shortages and things that are actually impacting our ability to serve the community, we can see that more.
No, that's really, really helpful, because just to know, we're funding a water justice person with the S tax. I don't know what that.
Right, what does that mean, right? Like, what does that actually mean to the community is really, so.
Great. Well, what a terrific segue, because the last thing.
Let me try to.
Oh, I'm sorry. Please.
I just want to share in the room, and it was in I've got notes here, but we're just not going to get to it because we're not going to see after 5 tonight. It's on the agenda and the calendar. What concerns me, like, this is super helpful, and that's why I said, like, I'm open to both of the offerings of information. What concerns me
when we start looking at outcomes measured, for me in public health, there's all this other work that's done. I'm thinking about mental behavioral health that we can't put the same numbers to. So it's just when we start comparing, my concern is if we start comparing 215 burn applications to youth mental health.
Absolutely.
So that's, I just want to share why I.
So another way that we kind of cut the pie is like, this is our regulatory work. This is our work focused on equity. This is our whatever. So we can also produce those.
I think that's something else actually you had asked for in the past, like what are we mandated to do? What are those positions? So tried to really answer those questions also.
So before we run out of time, I do want to put a little bit of time aside for Rachel Arndt to talk about the STAX outcomes. They are really running some amazing programs with terrific outcome data, as well as output data. And we know that y'all will be making decisions about that soon. So we wanted to give a little bit of a spotlight to that.
Sure, I can talk just a little bit about the healthy, local, sustainable food access programs that we are very lucky to receive sustainability tax funding for. There are 3 programs: the Fruit and Veg Longmont program, the WIC Farmers Market program, and the Farm to Early Care Education program. One important note is that for every dollar that we spend on personnel of those funds, we put more than $4 back to the community for local food dollars. So we work with local farmers, small minority-owned retailers, farm stands, nonprofits, and the farmers markets. I think that you might have slides with some of the outcome data, but as we're thinking about some of the mental and behavioral health impacts, I wanted to share that for the Fruit and Veg program, that's a program that serves primarily mixed immigration families. Over 83% report improved mental health from eating more produce in the program. We also, through that program, have folks self-evaluate their food insecurity at enrollment and at follow-up surveys. And there is a 35% reduction in food insecurity through participants. I know Claire talked about that when we won one of the NAPA awards for the programs in the past. And all of these programs are funded in part by the sustainability tax and in part by other funders. So we have funding through philanthropies, we have funding through other municipalities. In all of the programs, you'll see a really, really high redemption rate, which is nationally recognizable for how high the redemption rates are, especially for the Fruit and Veg program. Over 95% of the dollars that we distribute are redeemed. And that is really incredible. And I think it shows how much the participants value the program, how much the community-based nonprofits and organizations that enroll and identify these families value the program as well. We see through all of the programs that over 85% to 95% of kids are eating more fruits and vegetables, increasing their variety. So we're really proud of all of those programs. And then to be truer to the goals of the sustainability tax, to work with local farms for a greater part of the season, we're shifting some of the fruit and veg, we're shifting all of the fruit and veg Longmont programming in the peak season for our local produce to be, all of those dollars have to be spent at local farms, farm stands, and the farmers markets. We also, through the generous contributions from sustainability tax, are piloting the WIC Farmers Market program at new locations this year. So we're piloting in the mountains of the Netherlands Farmers Market and also the Lafayette Farmers Markets. So we're really excited to see how that pans out and excited to give you some more details on that. We also are funded. We have funding for a water and environmental justice program. So this position really protects public health and safeguards clean water through work that strengthens water quality efforts. And the primary ways that we're doing that are through a domestic well stewardship program. A lot of programs that focus on mobile home park or small community water sources, and through the Valmont coal ash cleanup. So I'll just highlight.
And can I just point something out? No one is in charge of wells.
That's true.
There's no body that's in charge of making sure that people's wells are clean, that they're getting clean water out of it, or managing drought or anything like that.
Yeah, these 7% of the county's population are on wells, and those are the most at risk of groundwater shifts with climate change. And so this year, when we're in more of a drought scenario, we have been receiving a lot of calls and a lot of concerns from residents about their wells running dry. Unlike a municipality where you have access to a larger reservoir or a bigger aquifer, each of these wells, we don't know the depth of them. We don't know how shallow they are. And if they run dry, it's a really, really large expense. So our water justice person has been conducting well stewardship activities across the county. In fact, there's one next Wednesday in Netherland. If anyone, it's on the 17th, is that two Wednesdays from now? If anyone would like to join, I can send information. But I think overwhelmingly, these events have been filling up within a day or less all across the county. We've supported residents with free testing through Colorado State. And we find that over 40% of the wells that are tested are exceeding kind of a critical contaminant level. And so we're really concerned about that because people don't understand how to manage their drinking water source. And Boulder County Public Health is actually implicated in the land use code and the comprehensive plan and in a lot of county documents for being the agency that is supposed to provide this service. So the work that Carl has been doing is amazing. Several other counties are starting to spearhead and adopt our model that we developed here with the sustainability tax funding. So we're really excited about that. And then I would just say for Belmont, we've been highly engaged with the housing department because we are so acutely aware of the drinking water and wastewater challenges on that site. The park tested for elevated PFAS and are still under additional testing before the park owner or the residents, whoever purchases the park or a new owner, has to implement any sort of treatment system. And so we applied for a grant, Carl did, through his work in this program. And over, I think, 85% of households have signed up for free under the sink water filtration that is going to be removing PFAS from people's drinking water sources like right away. So it's been a really good partnership. And again, we've been working for years to get the Mobile Home Park Drinking Water Act passed. And now having additional staff support to really support these communities that are suffering from these issues is really critical. And we're really happy to be able to have this position to do some important environmental justice work, and would be happy to prep you not after 5 o'clock on Belmont. I respect everyone's time, but yes,
We're happy to set up another meeting before you make S tax decisions if you want to ask additional questions or.
Yes.
All right, we are right at time, and I'm gonna end this on time. It's like my only job is to work harder than the day. And I'm not very good at that. Thank you everyone for your participation. We have lots of follow-up. I think we're gonna need to coordinate a check-in, I think, for budget, and we're moving towards finalization of budget. So we'll make sure that we get that coordinated and we are aligned on the right timeline, the right minutes that we need together to make that effective. If that makes sense. Thanks, everyone. Thank you. Yeah.